Jay. They're going to give like a 5 or 10 minutes experience sharing on how they're running the coil and how it benefits the innovators. But this is not just for innovators, especially for this particular larger group of stakeholders. We're intending to address also governments and also funders or investors who maybe we just want to bring up to speed in terms of what are the benefits of investing in interoperable systems. One of the things I think, and for those who've attended meetings this week, one of the main things that was talked about in terms of breaking silos is just enhancing. I mean, the main value proposition is that if you build your system as kind of in isolation for a particular use case, you really add value to your system when you get into a larger market when you make it interoperable with other systems, because then the use cases expand when your system is interoperable with other systems. So those are just some benefits that are there for innovators to be able to make the systems interoperable. And then from a government standpoint, when systems are built and fully tested before they're deployed at scale, you know you can have trust in them. You can trust that they've been tested, they've been validated, they conform to specific standards that you've specified. And whether it's a new procurement or it's an enhancement of an existing system, you'd be having more confidence in that system that's been fully tested in a proper lab. So the seal is kind of like takes a bespoke model where the hub will be based here in Rwanda, run under the HealthTech hub, and then the spokes will
can you see our slide?
I can see Anis.
Okay, good. IHIN is actually a community in Asia. We developed in 2011, and it consists of several these countries. And in our mailing list, there are also more than 700 experts of health information system, not only in Asia, but also in other regions, including in Africa, that include those from the ministries, academe, NGOs, and also other sectors. The description of IHIN has been introduced in this book published in 2022, edited by Evelyn Homenga and others regarding the roadmap of successful digital health ecosystem, a global perspective. In the chapter 11, we discuss the framework of regional health information system interoperability, the experience of IHIN. So in this book, actually in the chapter, we describe how the IHIN vision developed. Started with the problem in the digital health in our regional, that we have a lack of governance. All countries have their own architecture or blueprint, and some do not have the architecture. We also have a limited standard and interoperability, so that we have a problem for data sharing, not only among members of the IHIN, but also in the country itself. And there are also different implementation of the digital health in its countries. So we develop these philosophies as the first, we need to understand what are the gaps in our ecosystems. And then, given that we would like also to develop to improve the current situation, we try to, after minding the gaps, we also would like to fill the gaps. And so for each component, we develop several activities in terms of the governance, architecture, standard and interoperability, and also program management. The gaps is actually consist of this component, and also in IHIN, members, all the stakeholders will be sitting together to discuss, to identify what are the problem, and have the main consensus on developing digital health. And then from the architecture perspective, we also recommended that each countries also develop REACH, that is a Regional Enterprise Architecture Council, in which the main focus is to support the government to develop a blueprint of digital health in its countries. And among the implementation of the blueprint is how to have an information system that could speak each other based on the standard and interoperability mechanism, in which we also recommend in each countries to develop standard and interoperability lab. And then all the activities should be built together and tightened by a program management, in which the Ministry of Health should develop a program or a unit to ensure that all activities could be run together under the leadership of the government. So in IHIN, where is the position of COIL? So in IHIN, we have a board. We also have the IHIN Working Council that constitute member of countries, also part of the IHIN Working Councils. And in this IHIN Working Council, we developed these two program, REACH program and COIL, the Community of Interoperability Labs. So within COIL, there are a country standard interoperability lab. So for example, because I'm from Indonesia, in Indonesia, our University of Gajah Mada is working together with the Ministry of Health, in which the Digital Transformation Office, as the program manager to implement the digital health, we work together on implementing standard and interoperability. In other countries, in the Philippines, in Thailand, they have also their own mechanism and setting to implement the standard and interoperability based on their needs and also the context of each countries. So what Kyle can do? So in general, we could develop several courses to improve the the member of the COIL from the competencies building activities through basic course or advanced course for interoperability, for example, or bringing more understanding about the standard, including the classification and terminology standard. So another activities after understanding the basic and also advanced of the standard and classification and terminologies, we also propose to have more technical activities like a workshop on fire profiling and also evaluation of the existing fire resources implementation in its countries. And also, we also propose to conduct in a regional level COIL webinars that could be used for sharing experiences among countries. And we could also invite experts from other regions to speak about the new updated or the implementation of the interoperability from each countries, including, for example, implementing the international patient summaries or others. We also propose to have shared terminology servers and also country to country sharing knowledge and experiences, especially for the implementation of a WHO smart guideline. In the last IHIN activities, we also discuss about implementing a project. So for example, in Indonesia, currently I'm also involved in a IHIN project to develop a standard and interoperability for antimicrobial resistance using the One Health approach. So after the project completed, and this project in the final project also to develop based on the smart guideline WHO and then implement it for antimicrobial resistance. The result of this project are expected to be shared among the country members or among the COIL members in other countries. So we have this kind of mechanism of data sharing discussion among the COIL members, mostly through online webinars and also Zoom meeting. We have also face-to-face meeting if we have the activities like IHIN general meeting. I think the closing of this presentation is among the vision of IHIN is to develop or to achieve interoperable digital health system in Asia. So to achieve this mission, the availability and also developing the COIL is very important because it will give opportunities to promote learning, resource sharing, and also knowledge exchange among the country members. I think that's all from our side, and then I give the floor to Jay. Thank you.
Thank you, Anis. I would like to thank Helena for this opportunity, for inviting us to be at this important occasion of launch of the Africa Standards and Interoperability Lab. I would like to congratulate the team, and we look forward to have exchanges on a regular basis. Like we already have the collaboration with Helena, and then we also have Asia Africa webinar series running, and then we look forward to have more peer-to-peer exchanges, and then also like we also have many occasions to learn from you also. So we look forward for this opportunity to collaborate, and then congratulate you on behalf of AHIN for the successful launch of the Africa Standards and Interoperability Lab. Thank you again for the opportunity. For more details, please, like if you have any questions, sorry, we will not be able to stay back because we are jumping into another webinar. But if there are any questions, and please do reach out to us. Thank you, Helena. Thank you, Tom, Munia, for the invitation.
Thank you so much, Jay. Thanks, Anis, for very good presentation. So I think we really appreciate you. Sorry for the late start. And thank you so much for your flexibility and for your willingness to share your experiences. So thanks again. Yeah, so oh, is it off? Oh, you make me talk for so long without being heard. Anyway, yeah, we'll express our appreciation to them. So, yeah, I think at the beginning, for those who are new to Helena, maybe I didn't make that introduction. So Helena is the Pan-African Health Informatics Association, which, just like EHIN, is made up of individual national country associations that have an interest in promoting ethical use of health informatics through capacity building, through the use of open standards, through establishment of appropriate policies, and also other things like data science and data analytics and so on. So Helena is the African representation of the International Medical Informatics Association, and it's represented in each country. So here in Rwanda, the representation is the Rwanda Health Informatics Alliance, which is chaired by Mr. Sylvain, who's right here. So there were two of our speakers that were supposed to be here, but unfortunately, as you know, the closing ceremony is going on at the convention center. So the Africa CDC that was supposed to be here were not able to come because they're the main hosts. So they're involved the other side. But I just wanted to make it known that this project is not happening in isolation, even though I mentioned earlier that it's funded through the Global Fund and we're implementing it in collaboration with the HealthTech Hub. It aligns really well with some of the Africa CDC's flagship projects. Like one of them is the Sandbox, which for those of you who are here this morning, Chris talked a bit about some of the vision and some of the initial work that has already started on the Sandbox, which is going to be a resource that once available is going to be there for innovators to be used to test their systems for compliance, and just to ensure they conform to certain standards, especially for this project, our scope is around fire. But like this morning, as you saw, I mean, we had good collaboration, and we just showed how we're going to work with the IHE group. So we are open to collaboration. It's going to be a collaborative project. And again, as we've learned from EHIN, and this question came up this morning about country-specific implementations. So the bespoke system would have labs based in countries which are going to capture the in-country specific contexts, but then collaborate through peer learning facilitated by the SIL. So I'm not going to talk much. I'm going to invite my friend Sylvain, who wears two hats and chair of the Rwanda Health Informatics Association. So let's welcome Sylvain to the stage.
Hello, good afternoon. You are most welcome to our country of Southern Hills. Did you see the Southern Hills? You did not see. How many did you see? Maybe 100? 800. So you missed the 200. The 200, I think it is in the north, and I think you will be you can extend your stay, and then you can have a chance to see the remaining 200. So you are most welcome, and I'm happy to be here today talking about the very important topics that has been on our priority as government and as the Minister of Health. And I'm also happy that this is being discussed where we are having a HealthTech hub. A HealthTech hub for us as the Minister of Health, it's where we take solutions from. So means whatever HealthTech solution that we need, we have where to go and express our need, and then they have to do an innovation and give us the solution. We have been having a question that we think this initiative is going to be responding to. The question was like, okay, Minister of Health, okay, you have told us what is your problem, have created innovations, but it is possible that you may not absorb all of the tech innovations. So are you ready to certify us that we did a very good innovations and then we go to use these innovations outside or anywhere? We could not respond to this question because we did not have anything to use for testing, evaluating, and also support these innovations, certifying them, showing them that the systems, the innovations that they have been doing, it qualifies to which standards, and then it can be used by anyone. So now it's a great pleasure that we are hearing Helena and Ria partnering with Global Fund and HealthTech Hub, bringing standard interoperability lab here. It is coming to Rwanda, but it comes with a responsibility, and we totally understand that responsibility, as we have been also having those innovators coming from different countries, sitting here in country, developing, innovating. So it is going to be easy for them. It is going to be easy for them. They will be leaving Rwanda with a very good, complete solution, product certified, and also understanding that the standards that I have been looking for, now I'm able to have them in the same place. So we are happy that the initiative is starting. They asked me to link this with the universal health coverage, which is simple. As you understand the innovation that we are making, it is for our patient. It's for anything related to patient outcome. So if we are to create a system or a solution that is going to be enhancing the patient outcome, so we need this to be of the quality. So what do you mean by quality? You mean standards. If you say standards, you mean compliance. So there is no way that you will know that I'm complying to any given standard if you don't have anything that will help you to evaluate yourself. So this means if we can create quality systems, so we'll enhance the patient outcome, but we will also be complying with standards. So we totally understand that the seamless data sharing principles will be applied because these standards will be helping us to at least make the systems that we know they are going to be used not in one country, but they are going to be interoperable to other countries. So we expect this seal to be building the capacity of our internal innovators. As Tom mentioned, and also the previous presenter, there is capacity building. And most of the discussion that we had this morning at Africa HealthTech Summit, there was technical skills. The innovators that are here, they may testify that sometimes they are requested to comply with a given standard, but they may not be having that capability. Example, in Rwanda, we have built an interoperability framework. We have Rwanda Health Information Exchange, which helps you if you need to connect to, if you are creating any solution from the from one facility or one health facility, and you need it to communicate with other facilities, you need to pass through this interoperability layer. And this interoperability layer has standards. So which means, in order that you can hear me, it's because I'm speaking the language that you can hear. So in order that your system, your solution, your innovation can cope with the interoperability layer that you have built, it means you need also to change inside your system. That should be also a compliance to those standards. So these standards we are using, they are international standard, and actually we are using HR7 Fire. And you can imagine one innovator, if I say, okay, go and build a system that is HR7 Fire compliant. How are you going to respond? Do we think all innovators are going to be able to do that? This is a question of capacity building. This is a question of technical skills. Are they going to be able to hire someone expert from Asia and come and implement this fire standard in their solutions? They are not able. They don't have that kind of sustainability, financing, and all of those things. So that means SEAL is a very good solution for this. So if we can build the capacity, we can build the skills, the technical skills of these innovators, so they are going to be producing the quality systems that are going to be immediately interoperating with our own existing interoperability layer. With the SEAL, we are also access to patient data. As you understand, if I say standards, compliance, this brings also security and privacy. So if your solution, your innovation has been created following a given standard, all of the standard that you see, they are embedded with security and also privacy. So it means whenever you will be exchanging the data, whenever you will be, we will be using your system, and the patient data will be secured. And at the stage where we are now in country, I mean Rwanda, we are now creating the facilitation of patient to access their medical record. Previously, you could not ask me where is my medical record, and I think it is the same to some other countries here. So your medical record resides at all the hospitals and clinics that you have attended. So if I can ask you, can you please give me your medical file? It will take you maybe years to put together all of this. And sometimes you will go back to the clinic where you attended one time, and they have crossed and they have gone home. And they have gone with your data. And you don't know what they are doing with your data, individual data. So you can imagine this scenario. So this interoperability standard lab that we are creating here, we think it is going also to be supporting us to create the quality system that we will not be having any problem sharing with our patient, and then they can be accessing their medical record. Because it meets standards, it meets privacy standards, it meets security standards. So there is no problem. We don't care. We don't have any problem like I'm accessing the whole file on my smartphone because it is secured. So all goes with the standard. So I may talk a lot, but I know there's a limited time. I need to express our gratitude as Minister of Health, and also to understand that you as Helena, you as Global Fund, other stakeholders, you thought to bring this interoperability standard lab in Rwanda. We understand the responsibility, and we understand how much it is going to be serving the continent and the world. And we also are committed to support in the all angles, stakeholders, mobilization, and also giving you who to train, because sometimes you may come to build the capacity and you don't see who are ready to be receiving those technical skills and all kind of things. So I think we look forward for seeing maybe first system being tested, evaluated, and certified soon. We will be happy to journey with you this initiative. We totally understand it is not going to be one day, but we are ready to journey with Helena, HealthTech Hub, and also other stakeholders so that we can make this success. So we thank you very much.
Yeah, thank you so much, Sylvain. That's really encouraging to hear. And also just sharing what Rwanda has already done with the Rwanda Health Information Exchange platform, which currently, I mean, I can say it's functional because I live here. We can see data being exchanged through that national government-owned infrastructure. Yeah, so, Yeah, it just confirms the fact that interoperability enhances the value of your product instead of it working as a standalone solution. Okay, so we're going to get to hear from one or two innovators, just so that we're not just talking, but also just to hear what the expectations are and so on. And then after that, this morning we had a very well-talented panel, which consisted of David, I don't know if David is here, Chris, and Abdallah? Yes, oh, there he is. Yeah, so we got some questions online, which we hope you can respond to. So maybe once we get to hear from the innovators, we're going to ask those questions, and if you don't mind, if it's relevant, if you're happy to answer either Chris, David, or Abdallah, if any of you can take the questions as they are fielded. So let's move over to Babakar Fall.
Good afternoon, everybody. My name is Babakar Fall. I'm from Senegal, and we are an HIS, Hospital Information System provider. And we've been approached by the consulting company Kaikai to participate in a project to incorporate interoperability into our product. And that was something that we were looking forward to do. And we were facing some technical, I would say, challenges, because if you want to go through the FHIR, I would say, implementation as a company, when you don't have so much resources, it can be very challenging. So we saw it as a great opportunity, and we participate with two other HIS provider. And that was really a blessing, I would say, experience, because they hired VisuApps, who implements the IHE in Europe and has great experience. So we went through a training for like 2 to 3 months, and then after that training, we did a mini connectathon, and then after that we upscale basically the implementation to be able to participate in connectathon in Europe, in Italy. And basically what we got from this experience, it's an added value to our product, because as a local provider, we are very scrutinized in terms of, do we really have the quality? Because we know that technology is not something that where we are number one. Most of the time we import technology from other regions, so we have a tendency to underestimate the quality of local provider. And the interoperability, it's one thing that when you have gathering, technical gathering about e-health products, that always come to the table. So if you as a service provider, you don't provide it, then that means that you are lacking a big piece of technology. So that means that for us, in terms of value of our product, that was something really that we needed. Now, part of the equation was solved because we demonstrated and we went through the process of acquiring the technology. But then the question is, in our country, the government did not decide yet how to implement the interoperability. So which means us as a private sector, we have to take kind of like the lead to go with a system. Meanwhile, we are waiting for them to suggest or to recommend one system of interoperability. And I think that with this type of summit, I see that it would be extremely important if some kind of pressure or some kind of way we can have recommendation to push to country level, to really advocate the urgency of implementing this type of network or platform in order to make sure that the local providers can have a complete system to be deployed. Because if you don't have it, then you have like the silo effect. We have our clients that can use our product, But if we, let's say right now we have a mobile application, and one patient who's using our system is interested into having their medical record, and we know that the medical record is produced by different health facilities. Some of those health facilities are using our system, so they can have access to that data. But how about the other health facilities' data? How can they access to it? And for our system, for our market to be viable, we cannot just produce product for the public health. The private sector needs to be also supplied. And those patients, when they go there, I mean, it doesn't matter what product or what software those private sector are using, they are interested in having access to their data. And that's where the interoperability is very important, regardless of what the government is really doing in terms of strategy. So I think that it will be very important for this summit to have a way to push throughout the countries. So some of those actions that can only be taken by the country level. Because us as a private sector, we cannot implement the interoperability. I can talk to one of our competing company and then say, okay, let's try to have interoperability between us, but then you have so many others. And if the government decide to go a different way, then all the effort we put will almost be going down the drain. So again, this is a really nice experience that we've been through, and we recommend it also to other companies. And tomorrow, I think that there is a workshop to know a little bit more about the IHE implementation. And we are very grateful because IHE, we know that this is a long-lasting, I would say, platform. And of course, it's a little bit heavy. It's not light, but because it's heavy, that's why it's, I think it's very stable, and it can be very lasting, I would say, option. And I know that right now there are some other options that are like Explore, and just wanted to say that so far we are okay with this option. Thank you.
Yeah, thank you so much, Babakar. Yeah, I think that's a very good illustration of just how SEAL can contribute to helping with building opportunities for interoperability even within a country's context, just to be sure that it opens up opportunities for systems within a country to talk to each other. So thanks so much for sharing your experience. And then next we're going to have Harrison Mariki. Yes.
Good afternoon, everyone. My name is Harrison Mariki, and I come from an organization called Afya Intelligence. We are one of the few innovators working around helping with healthcare products and analytics. So helping facilities understand the demand of what is needed in the facilities, helping government be able to aggregate that demand. As you know, the journey of a healthcare product in our context is very long, because most of the products actually we are importing. So you have to know well in advance what will be needed. So that's what we are trying to do. To do that, there are a lot of stakeholders that needs to be connected. So it's very important for systems to be able to speak to each other, for there to be standards. So I'm very happy with the initiative, because it has both standards and interoperability. In my experience, we've come across systems which are interoperable, but not with standards. So at the end of the day, you still find duplication. So when there is standards of, for instance, how products are recorded, the products codes and all those things, it really helps for us who are working in the analytics side to really be able to support our stakeholders. In terms of interoperability, I know that's, as we're all speaking, we're all into it. I know in my country as well, there's currently a standing order, presidential order and ministerial order to make sure systems are are speaking to each other, and there is ongoing effort to make sure that at least the public healthcare systems are speaking to each other. And for us as a a company operating in this environment, we are looking forward to how this initiative will go ahead, and we'll leverage this and the stakeholders that we are involved in. So being able to work with all these stakeholders, I already know that we'll need to have this capacity within our organization so that we can do business, but also strengthen the partners that we are going to work with to make sure that they know what is required so that we can work better with them. Yeah, so for me, I didn't have much to say. I just wanted to share that with you. Thank you.
Yeah, thank you so much, Harrison. So maybe before we go to that Q&A session, I was just going to ask if there are any funders or investors in the room. I think that's the only voice we haven't heard so far. And what they see as potential ways of engaging with the seal. Any funders, investors in the room? Yeah? You want to say something? Yeah? Okay.
Looks like investors are shy, but but we'll have another session for investors. But what I would say is why it's important for me as an investor to have standards. Sorry, to have standards and interoperability is about scalability, right? If you are looking at just single market, single country market, that's very small for me as an investor. So the only way you can scale across region is only if you are adhering to the standards and your system is interoperable. So I think as investors, we're gonna be adding that as a selection criteria as we evaluate. First of all, we normally look at impact, revenue, scalability, but then we might need to add a check for, is your system interoperable and is your system scalable? Yeah. So that's what I would say, representing all the investors here in the room. Thank you.
Yeah. Thanks. I think that's pretty important. I mean, the issue about scalability and interoperability as a requirement for systems that are funded by investors. So yeah, it's a great voice and great message. Okay, so with that, I think I'll request Chris, Abdallah, and is David here still? Okay, please come and take your seats, and then I'll hand it off to Gilbert to run the next session.
Hello, good afternoon, everyone. I don't know, have you not taken lunch? I've not heard anyone say good afternoon. Good afternoon, everyone. So we had a panel discussion earlier in the morning from 9 to 12. We had various presenters presenting on various standards, how important it is for solutions coming across Africa to become interoperable with each other. And we've had a couple of questions coming up, and I'll just shoot particular questions which I know that we had already talked about. One of them, I think, that is already coming up even from the talks that have been going on in the African HealthTech Summit, is around the sandbox. And I won't ask the particular question. I just want Chris to just expound on what the sandbox is, just tell people what to anticipate, and basically what we had discussed in the morning. Thanks.
Sure, thanks very much. So the Digital and Data Innovation Sandbox is a flagship project of the Africa CDC. That was created a couple of years ago. It's led by Kwala Health at this stage. Gembi, the company I work for, is one of the collaborators on the project, along with the DataSphere and one or two others. Helena is also contributing to it. So it's a project that we've been working on for, well, I've been involved for just over a year or so, and we've we went through a process of trying to understand originally what the concept of the sandbox was that was envisaged by the Africa CDC. As people may know, the concept or the word sandbox is quite overloaded. It means different things to different people. So some of the drivers for the sandbox were to kind of provide an environment that health tech innovators could use to strengthen their innovation, to facilitate innovation. And how we interpret that is basically to use, reuse, or to host or make available reusable building blocks, access to standards, the ability to adopt those standards, to test them, and to potentially also subscribe to regulations. So that was another piece that was added after the initial formulation of the sandbox, which was also to sort of copy the idea of a fintech regulatory sandbox. So this was all lumped together into one sort of flagship project, and we've been working over the last year or so with that concept, and have come up with an architectural design which merges together the elements of compliance and conformance testing, much like what we've heard the SIL is planning to do. So in the context of interoperability and content standards, the sandbox is designed to both provide access to innovators to adopt those standards and use them and implement them in practice, and then also to test them. So from the world of standards, and IHE is represented here, they are very proficient at testing IHE profiles. There are also other ways to test implementation of fire standards, for example. So that was the main component of the sandbox. And then, as I say, the regulatory part was also added to that. And the idea was that as African countries start to embrace a form of regulation for digital health, that these regulatory or regulations would also be stored in the sandbox and also be represented in such a way that they could be tested in practice. So some of the use case, these concepts are sometimes difficult to describe, but an example of that would be like a Data Protection Act that is being adopted in a particular country, how we would look at the act itself, and then how that is actually implemented in the software to make sure that the provisions of the act actually are supported by the software. So that's a kind of concrete example from there's also ongoing work to look at things like how functional requirements would flow down, might be specified, and then in a policy, for example, and how those would then be tested in software to ensure that software that claims to provide a certain function actually does that. And other things as well, that it does no harm, that it protects personal information, etc. So, sorry, that might have been a bit long, but I hope that explains.
Thank you, Chris. A round of applause for Chris. So a lot of the questions that we've received are around capacity building, and I just want to ask David to kind of highlight the importance of capacity building, because one of the key focus for the SEAL is to capacity build government agencies, innovators, development teams, in terms of standards and interoperability frameworks that are available. So maybe you can talk about how important it is for development teams to be able to be trained around those areas.
Right. Right. Thanks. Is it talking? Yeah. Okay. Yeah. I think so. I'll just give an example of what we did in Kenya. So whereby I think there came a point whereby we were just doing a lot of fire-related work, and by that I mean like building the fire IGs. And I think capacity buildings usually help in terms of like maintenance aspect of like the work that you're developing. So for example, you find that we have such group of, we have like a lot of group of people that are actually doing almost like parallel things, and if that is trimmed down to just, I mean, if that is brought to sorry. So what I meant is that, so for example, you realize that we started developing a lot of IGs almost at the same time in Kenya. And the only group of people who were working on that was just specific, just a small group. And the challenges we got was how we are supposed to respond to those requests at the same time. So for that, the government really helped us in like making sure that we dispense that information and skill set to different people so that they can also help in maintaining that. So that has really helped us. So the aspect of capacity building is just to make sure that maintenance and growth is not attributed to just small set of people. So having distribution of knowledge really helped us a lot in that. And it's something that we've been doing a lot just to make sure that we have different people working on different stuff, and that really brings about accelerations to development of the technology.
Round of applause for Chris.
I think that's on a bit of useful information about training and capacity building. So Helena has a partnership with HL7. I'm assuming that the question was around fire, right? So in addition to what David has said, Helena has a partnership with HL7. We are the Africa affiliate partner to HL7. If you're familiar with HL7, is a standards development organization that develops fire and sort of like markets fire as a standard. So one of the things we're working on is to lower the cost of training. How many of you have taken a training in fire, if you're a developer? Okay, so if you're interested in training in fire, please see one of us. Right now, let's say you're one of the entrepreneurs and all that. If you want to get trained in fire fundamentals by HL7, it's about $450 for a single learner. So it's pretty expensive for most people. So we're trying to lower that to below $100 with HL7 without compromising the quality. So if you're interested in training or getting trained in fire or getting competent in fire, please speak to one of us from Helena, and we can get you on a waiting list. We're also getting a bit of scholarships as well. So for those of you who are interested, and we can pass on those scholarships to you. So please get in touch. Working with Africa CDC, we have a high target, a really high target of training people in basics of fire, because it looks like many countries have adopted fire. So we might as well train a very big workforce around that. So please get in touch with us. And there are many organizations here. I'm looking at Matt as well, who's implementing fire native applications. So there's a lot of hands-on that's going on, and I'll speak about that when I'm invited later.
A round of applause for Steve. I know we had talked about connectathons in the morning, how important they are in terms of the roadmap to certification. I know so many people, so many startups, so many companies would like to, start that journey towards certification. I know, Abdallah, you are one of the people who has much experience around connectathons, around the IHE profiles, and maybe you can speak about that and broaden it up to any other standard.
Yeah, probably I can start with the definition itself of a connectathon. So it's the testing event that is organized every year in Europe, United States, and Japan. And it's a big debugging session for enterprises that go in there to test their implementation. And what they test is actors and integration profiles. That's the terminology given by IHE to the use cases defined in IHE specification, which is called technical framework. And the actor, they are the application that are implemented. During a whole week, we test these applications with 3 different partners to make sure that we are able to communicate with different implementations, not only one partner, but we test with 3 implementations. Once we are successful in implementing those, in exchanging with those partners, we make sure also that we validate the content that we exchange, because there are also conformance tests, not only compliance tests during the connectathon. And once the connectathon is finished, before that, for sure, you need to implement the application itself. Once the connectathon is finished, IHE publishes the results, and those results will be included in what we call an integration statement that every company can publish in its website, and it can publish also in a portal called Product Registry, where architects can go and search for applications who are compliant with the feature they are looking for. For example, searching for a patient, inserting a patient, submitting a document, and then this is the certification process somehow, and we call those actors that are passed during the connectathon stars. But now IHE came with a new terminology was called seal. And why it is a seal? But it's like a stamp that your application is approved by the IHE during 1 week, where you tested thoroughly your application, and it was approved by many monitors during that week, and in the end the IHE committee signed on that report that your application is compliant. I hope this answered your question.
Yeah. A round of applause for the panel that we had in the morning. Maybe we can take a seat. There's one final question that came about, and I know because the next person I'm handing over to is Tom, and I know the next person that will be speaking is Stephen, and that was around the alignment of the seal towards the different initiatives that are coming up around Africa. And this is all in terms of standards and interoperability. How is the seal aligning to the different initiatives that are coming across Africa? So as I hand over the mic to Tom,
Yeah, thanks so much, Gilbert. So, I think as we've had, especially those who are able to attend any of the sessions that covered the flagship projects by the Africa CDC, you heard about a couple of them. Of course, standards and interoperability. One is the sandbox, which I think Chris talked about this morning. So we see ourselves as aligning to some of those Africa CDC's flagship projects. So we're not doing this in isolation. We are aligning properly. And then I think more recently in discussions with Niels and the team from the IHE, so again, we're seeing we're aligning to some of the other global initiatives that work towards interoperable systems. So this is all not happening in isolation, and it's also happening along the same lines that, like the Africa Union and the Africa CDC, through its work in the policy and standards that were published for health information exchange, advocate for the use of open standards for data exchange. And there's appropriate policies which includes things around data sharing agreements, things around data security and data privacy and so on. And also along the same lines as what countries are implementing. I mean, many countries, I think about 37 countries in Africa have now enacted laws that promote data protection and privacy. So all this is very well aligned with all those initiatives that are going on around the country. And I think we're not doing this in isolation. And my happiness is that it's a global best practice. Using open standards for data exchange is a best practice, and it's happening elsewhere in the world. And Africa should be really at par with some of the other continents that are working on the same. So I think with that, I'll invite Steve over to maybe make any additional comments, and then maybe formally lead us towards launching the sale, and then we'll hand it back to the hosts. So welcome, Steve.
Thank you, Tom. I don't know how much energy you have, but I have about 30 slides. No, I don't have. So my job is really easy, and I know we're supposed to finish this session at 3, so we won't respect people's time, and we'll try and finish on time. I think we have about maybe 8 minutes. So I just want to reiterate a few things. I'm really sorry I wasn't able to join the meeting in the morning. But for those of you who've been here in the morning and right now, do you feel somewhat convinced that this thing is important? I mean, let's just be honest. You don't have to say yes because of other reasons, but do you really honestly, do you really believe that Africa needs a standards and interoperability lab? Yes. Why? I'm just curious. Does everyone agree with what Sylvia said? Sylvia represents Rwanda, obviously, but is that representing the 55 countries in Africa? I mean, I don't know what everyone is doing in the health space, but I'm assuming that all of us are using technology in health. From what you're doing, is this really important? Why can't you just do it yourself? Why do you need a centralized lab and spokes around the country? I think these are important questions to ask ourselves. Obviously, some of us who have the opportunity to contribute to this believe it's important. I want to thank Japaigo, Global Fund, and others who have put in resources and effort in this. Because for many reasons, what we're trying to do here is, I think technology is getting to a place where it's not a nice to have in healthcare. Before it used to be for managing health records, we used to sit in the basement and all that. But now we're at a point where we're saying technology is an intervention in healthcare, right? I think we're now talking about, if you're in the Africa HealthTech Summit, it was all about AI. And now there's Gen AI, which I don't even understand, right? So it's getting to a place where it's actually an intervention, so which means that now we have to start caring about quality. So if you're using this tool to intervene in delivering services, then the question is, are we building high quality tools? Now that's a very slippery argument to have, because how do you define the quality of software, isn't it? But if we don't start defining that as actors in the space and builders of software and implementers, then very shortly, governments will define that for us. And I don't think we want governments to define for us standards. Because then they come with the big stick and they say you can't do or you can do. So I think the whole idea here is this initiative is for us to actually start defining the standards that we want to live by as we build software for the health sector. So FIRE is a set of quality statements that says your software has to do 1, 2, 3. And as builders of this software, we're trying to say, how do we actually do that? So not all of us have the capacity nor the resources to determine how to do that. So just like other labs operate, we're setting up this as a platform to help all of us lower the cost of testing our software and making sure that it actually meets some level of quality measurement. And then over time, that will become, might become a regulation in certain countries. But that's the whole idea of the seal. So please participate in this seal. We're very happy that it's hosted by HealthTech Hub. Our friends at Japaigo are doing a marvelous job. We're happy that we're also impacting the private sector, all the entrepreneurs who are going through the hands of the HealthTech Hub. Please make use of this, this lab. It is functional, it's up and running, but it's not one of those things that you can just, it's not a physical thing where you can, have lab benches and machines running, but the services are actually available for you to access. Before I make my last statement, I just wanted to mention that there's a lot of other work going on, other initiatives that are going on, where you can actually do this as well. Not necessarily a lab, but if you want to build your capacity, there are a lot of initiatives around the world. So one of them is, I would encourage you to join the WHO Smart Guidelines Working Group. It happens virtually a lot every week, but there's also a lot of activities around the world. This year, in December, we have the Open Digital Health Summit in Nairobi. You can check out fullstack.health for more information there. I know the applications have closed, but just check it out and see whether you'd like to get engaged. And there are many other opportunities that are ongoing on a regular basis that we are working on. As Chris mentioned, this work is anchored within Africa CDC's interest through the flagship called Sandbox. So we're not doing a side thing that is, for the excitement. It's actually right in the middle of an authority, an Africa CDC authority. And then at the government level, you had from Sylvia, we're working directly with ministries of health and engaging with them directly through support from HealthTech Hub and Japaigo. So for all intents and purposes, this is not like a fun thing. It's actually going to be central to health development in many countries. So we'd like to welcome you. We don't have all the answers. We don't know everything. We are arguing about what tools to use for testing, what methodologies, even what standards. There are people who don't believe in FIRE as it is right now. And that's okay, but we want to engage through this lab and test out. If you have a better idea, come with it. Let's test it out. Let's have the sort of thing we had in the morning. The last time we were here at Nosken House, we had a really, really nice hackathon, 5-day hackathon that went really well, and we want to have a lot of those over the next coming months. So I hope that everyone is convinced about the lab. That's the purpose of this long speech I'm making here. Yeah? And I hope that you'll actually not just be convinced, but you'll step out and look for the lab. Has anyone seen the lab? Ask Tom where the lab is and he'll tell you. But yeah, please step out, reach out to us, and we'll ensure that you access the lab. As Sylvia mentioned, and I think Abdul mentioned as well, there is, if you're a businessman, there is benefit in having that stamp of my system complies with this standard. You've heard Sylvia mentioning that, and Sylvia works for government of Rwanda. They're not going to endorse any system or say that you can go to our market if you don't have a certain type of approval. And this is just the beginning. Over time, I'm sure to get to a point where Sylvia, speaking for government, will say, now you cannot even deploy your system here if you don't have 1, 2, 3. So I think this is a period you have to start complying with the standards, and we're happy that this facility is available. So in closing, before I invite Wilfred to give a vote of thanks, we don't have fancy, dancers and all that to, and so the last statement I'm making is that this is a declaration, and that's the whole point of the morning session and this session, that this is an official launch of the Standards and Interoperability Lab for Africa. I want to thank everyone very, very much for making your time to actually be with us all through. I think this is validation that you're really interested, and for us, this is more of validation that this is a real launch than some symbolic thing that we would have otherwise done. Yeah, thank you very much.
Yeah, I think we can do better than that. Let's appreciate Wanye. I have 2 questions for you, Steve. One is the connectathon. When is it happening? I was keen to hear when and where it's going to be. In Nairobi? So 1st to 3rd of December, just diarize that. During the Global Digital Health Network Summit, there will be the connectathon. As Abdallah was sharing, you get a chance to share, test your platform against the standards and see how you perform. Yeah? So I'm going to usher us to the next session, which is a pitch session. So if you, before I do that, I want to give a vote of thanks to our partners, Global Fund, who has enabled this launch of the Standards and Interoperability Lab. I also want to appreciate Ria Gilbert, Rwanda. Ria stands for? Sylvain. Rwanda Health Informatics Alliance. We also want to appreciate Helena. I also want to appreciate Jepaigo and HealthTech Hub Africa, who have made this possible. And of course, not forgetting Africa CDC. So let's appreciate them with a round of applause. Because someone had to do this. And I'm assuming most of them had to volunteer their time to get, because when you start doing standards and interoperability, no one is really paying you to do this. This is a global good in terms of a standard. So it's out of their generosity with the support from the funders that they've been able to set this up for all of us. So really appreciate you, Steve and team, for leading this initiative. We want now to transition to another more exciting part. We've had 10 months acceleration program at the HealthTech Hub Africa, where we've accelerated about 30 startups in the last few months. And today we have top 11 or top 12 of them pitching to us. And as they do so, Steve, maybe you can be checking on standards and interoperability piece. Are they actually complying? So I would like to invite anyone who affiliates themselves or consider themselves as an investor to take the seats up front. I can see Steve Seu of Jazarift. I saw Pulkit from GCC. Please come and take a seat at the front. Maybe we can make space for the investors. Huh? Which? Oh? Sure. To the investor. Yeah. 1 minute. Yeah. So I'm told that there will be a short Q&A on standards and interoperability. I realize that we cut it really short. So don't go if you had questions for Standard and Interoperability Lab. But as we do that, let all the investors come up and take the front seats. And then we'll take a few questions for Standards and Interoperability Lab, starting with the gentleman right here. And
as you can see in the program, and we've had merged two events, I want to thank as well Helena again for the agility, and Norsken also for providing this amazing space. I'm very jealous coming from Dakar about your environment, your work environment. And we saw this morning that there was so many questions, and many of you, I'm sure, still have some burning questions. We don't want to take away from the pitching sessions, so definitely support these innovators. We know how hard it is to pitch, so please support them. But if you have burning questions for the experts that spoke today, we can meet in block 5 where the morning session was and take a few of your questions one-on-one. Thank you so much. And thanks again, Helena, for accommodating us, agility and living interoperability. Thank you.
I think we had one question. Oh, okay. So Pulkit from GCC, you're here, right here. Welcome, Carl. Who is there? There were a few other investors in the room. Norsken, do we have someone from Norsken? Maybe as I help the judges and the jury to set up, I would like maybe Sarah, if you can give some remarks about Novartis Foundation and the support you're giving to the HealthTech Hub Africa and how people can apply for the next one.
So hello everyone, good afternoon. Thank you so much for being here. We're really pleased to see great attendance and interest in the work that we're doing at the HealthTech Hub Africa. So as you probably know, the HealthTech Hub Africa was founded 3 years ago, co-funded by the Novartis Foundation, the Global Fund, and the McGovern Foundation. And we offer acceleration program for startups across the African continent. So every year, a cohort of startups is selected and we'll go through an acceleration program. They'll be provided access to mentors, to experts, to investors. They also go through trainings around different thematics that support their businesses, that support them to grow. So this is a big component that we've been doing to really support the startup and entrepreneurs ecosystem in the health tech sector. We're very proud of our startups. To date, we have over 100 startups part of our cohort. Every year we select about 20 to 30. And we will be launching a call for application towards the end of the year for next year's cohort. And so we really encourage health tech companies to have a look out for that and to apply if you feel that you meet the requirements and also that you require some support to grow your business and to think about scaling. I think the HealthTech Hub Africa really offers an amazing platform of partners, of connectors, of investors, of experts that can hopefully really boost your business and support you to build commercially, but also to have access to governments in order to also implement your solutions in the public health systems. So with that, I think we'll kick it off with the next session, which will be the pitch session, where you'll have the opportunity to meet are top startups of the cohort of the HealthTech Hub Africa. Thank you so much.
All right. I'm told that the clicker is, who has the clicker from the last? Okay, there you go. So the startups, I see you are ready. Stay with it, okay. So we'll be having about 12 startups. We don't need the seats here. Maybe someone can help me remove the seats from the stage. And we are very lucky that we have 4 investors in the room. We have Grand Challenges Canada, we have Path, we have Jazza Rift Ventures, we have Renew Capital, and I'm told someone from Nosken is either around or is coming. So we have 4 investors. So as you pitch, these investors will be taking some scores. They'll also give you some feedback, and they'll also tell you whether they would invest or not and what are the things they look for. Yeah? So the order, so that you are ready, is we'll start with Afya Intelligence, followed by Clinic O, followed by Helium Health, then we'll have Izora, Therapeutic, MedPharma, MedTrack, Honor Kenya, TransMed, TC4A, Thalia, TPN, and finally HealthX. So Afya Intelligence, where are you? Are you ready? Please come up front. You have about 5 minutes for a pitch and 3 minutes Q&A. Karine, standing out there, will be giving you a time check, a time warning, 2 minutes warning and 1 minute warning. And yeah, so take it away.
Good afternoon once again. It's my 3rd time today speaking, but wondering why I'm still shaking. Maybe it's because what I'm presenting is something that I'm very much close to. It's very close to what the effort that I want to make in terms of improving my community. So my name's again Harrison Mariki. By background, I'm a pharmacist turned into health tech entrepreneur. Throughout, I've worked in healthcare supply chains, supporting facilities in improving healthcare. So the why am I doing this? Stockouts. You can have a good service pipeline, but at the end of the day, if the client does not find the product, then we haven't helped. So that's why we really want to help this. And in public healthcare supply chain, this is very critical because I don't know if you know it, but facilities get to order maybe once every month. So if they get it wrong, the logistics of getting that product is really challenging. When you go at national level, the pipelines are very long. So countries have to get it right because it takes months for them to organize all the stakeholders, get the funding, make sure that the products are there. And so we've done it, going across facilities, training them, and I've done it for 12 years until 2021, when we decided now to try and leverage technology to automate the good work that we are doing in training and helping these facilities do it on themselves. So facilities, healthcare, they don't have the time, skills, or tools that are currently supporting them in understanding the demands. And so, it's not going. Maybe someone can help me with this. Oh. Still not working. And working health tech. Thank you. So what are we doing? So currently we are building, we are providing AI assistance for healthcare to be able to understand the supply chain risks well in advance and be able to plan for what is needed. That's what Afyalytics is. What it does is just is connected to their business processes currently. So when I say routine ordering, so we are connecting, they can use it using that use case. When it is forecasting for the annual demands, that's what it will help them with. And they don't need any formal training for them to be able to use this. All they have to do is just, if the system is not integrated, they can just upload a CSV from the most widely used systems across Africa, which is the OpenLMIS and the DHIS2. So those are the systems that currently we are working on to help them. So in Tanzania, if someone can help me with the slides, please. So this is what they have to do. They just have to go select that task, which is routinely done every time with all these facilities, so no one has to do the analysis every time. So we automated it. They just have to select the data source, and then once they upload, they will get the insights. Well, it seems very simple, but it has great impact. If you move to the next slide. So in the past 2 months, we have been able to analyze more than 45,000 records. And the total value of the products for just 250 facilities was around 13 million. Within that, we've been able to provide recommendations for where there was duplication, which sometimes comes up with the issues that we're talking about in the morning. But also, because of people not understanding the guidelines. We've also been able to make recommendations for products that were missed, but these were priority products that are listed. For instance, for a dispensary, you're supposed to have these 100 items. For a health center, you're supposed to have these 120 items. But these were all missing within the facility forecast. So these usually will be seen later on when a client is going to the facility and missing out those items. That's when we will see the issue. But with Afyalytics, they are able now to see this now, which is 12 months in advance when the government currently is collating the demand. So you'll see that cycle. So what is happening now, the district managers who did not have this tool to help them with the review of the forecast, currently they are doing the review. They are sending the review back to the feedback to the facilities, and this is getting improved. What we are able to do with this as well is be able to aggregate that demand and provide feedback to the other stakeholders along the chain. Thank you. I think that was my time. I was able to get. If you move to the next slide, thank you. So as I said, so it's now trained on more than 300 products, tested with those 250 facilities, can support multiple programs to make sure that the products are there. It's co-created along the users, different implementing partners that are supporting the ministries, so supply chain experts, and currently being used in across facilities in Tanzania. So these facilities are distributed across the country. If you move to the next slide, thank you. So as a data consulting company around the healthcare supply chain, this is our traction for 2022. This is how much we have been able to raise. So now it's as revenue. If you move to the next slide. So you can see there's progression. In Tanzania, we are thinking that we'll be able to do this in the next year. We'll scale across the public sector, but also are looking to scale across the sector, moving into the private sector, where we know there is also a lot of demand, and currently there is no visibility in terms of what is happening in the private sector. Thank you.
We have 2 minutes of Q&A, so just stand there. Don't go too quickly. Any questions from the investors?
Thank you very much for the presentation. How do you compare to Dawam Kononi?
Interesting, and I see Joseph sitting there. So we are actually a complementary service to Dawam Kononi. Our more than 12 years of experience in the supply chain, we can really help them. I know they are a HealthTech provider, but we can help them understand what the demand is, and we can help them actually have more impact with the public sector as well by sharing that information. Thank you.
Very interesting, but to the point, what do you want? What's your ask? And the other side is, what's your revenue model? How are you making the 80,000 a quarter?
Thank you. I didn't get to that slide, but so our model currently is B2B to G. So as a startup, we are partnering with other companies that are already working with the government and being able to provide this service and making it accessible. So they are paying us. That's how we've been. So we cost it in terms of level of effort, but also maintenance and support as needed. So if it's a new use case, it's different. If it's an existing use case, then there's a way of costing it as well. So far, for the past 2 years, we've had around 10 contracts for data consulting services. The average, it ranges around 50K. Yeah. So right now, we are looking for to raise funds to grow the business. So it's equity, but I think that's a discussion that we'll be actively doing that in the next year, not now. Yes, thank you.
All right, let's appreciate Harrison once more. Next, we have Clinic O. Clinic O.
Thank you so much. Can I have the... I'm going to go and introduce myself while they are putting the slide on top. My name is Nasser Diallo. I'm from Guinea-Conakry in West Africa. And I'm the founder and CEO of Clinic O. Great. So, in West Africa, we have 460 million people. And among those 460 million people, 100 million people have no access to healthcare. And my dad was one of them. I saw him suffering from diabetes, type 2, a condition that could be absolutely prevented. So from our rural location to the capital city, it's 300 kilometers, and it was really devastating for a low-income family. So that's why I'm doing this. Poor infrastructure, shortage of qualified healthcare workers, and challenges to link people to care. What is our model? We have a medical ID card and a digital medical record, and we work only on rural locations with the Department of Community Health at the Ministry of Health in Guinea. What we do, we care a lot about preventative care, mainly the determinant of health. So we go in the community, we collect data with everyone, right? Whether you are sick or not. And then we screen you, that's step 2. If you have a challenge, we can link you to care via telehealth. And then we take that data, we use that data in accordance with the government to activate it for policy, impact, and campaigns. We are in accordance to the Sustainable Development Goal 16.9, Identity for Development, and universal health coverage. We believe everyone should have access to healthcare wherever they are, irrespective of how much they make. I'm starting in Guinea, my home country, but the aim is West Africa, where we have 100 million people. Again, we are mainly in rural locations. What is our business model? We ask people to pay only $1 for the care they need. And then we work with government and the private sector to run campaigns to activate our data. So far, we have raised over $400,000 with these models in terms of revenue. This is our impact. We have reached 50,000 people. 15,000 of these people are in our application. We are in 6 communities, 95% of satisfaction. 65% of these people were supposed to travel over 300 kilometers to go to an emergency room. And transportation cost, it's $22, 4 to 6 hours in terms of travel time saved. We are seeking $3.2 million to reach 500 people in the next 12 months and bring the cost of healthcare from $21 to $3 for low-income communities. This is our game plan. Right now, we are testing and improving our model. We will raise the $3.2 million, and then we will scale around 2026 to open to West Africa. Right now, we are in conversation with Senegal, and they are highly favorable to our model. This is our partners. I want to recognize here the HealthTech Hub for supporting us. I want to say thank you to Olivier. I want to say thank you to Karine from Vulagro, and I want to say thank you to you, Joanne, for supporting and helping. This is our team. We have a team of local leaders who understand what we are doing in Guinea, but also a team of local experts who are helping us to build our solution and our technology. Thanks so much.
So we take a few questions, starting with
Thank you very much for the presentation. To the point, you haven't. Can you give us a bit more detail as to what you're going to use the 3.2 or 5 million to do? Thanks.
So we entered into an agreement with the Guinea Ministry of Health by which they ask us to digitize the healthcare at the community level. That's 400 community health centers for 8 million people in rural locations. So we want to start with 10 of those community health centers, which has a catchment area of 500,000 people. So we want the $3.2 million to help us digitize those community health centers and work with community health workers, provide them with technology, provide them with a platform that link 10 community health centers in Guinea as a next phase before raising funds to go to the 400 community health centers.
Can you talk about the technology that you're using? Is it proprietary technology or is it like third-party software solutions that you're using?
Our technology is proprietary and we want it to be that way. We believe in a business model that is sustainable. There are so many open source technologies that are doing exceptional work and we think we can complement those solutions. But we believe in terms of building a business model for people who cannot pay, you have to have a revenue model, right? So it's a proprietary solutions that can be integrated into open source technologies. It's fully integrated to the DHIS too. So we have brought in even the Ministry of Administration and Territory in Guinea, who is interested in using us as the primary organization to collect birth records. So people can go to our organization to apply for birth certificate, so we can do cost sharing with them as well.
Could you speak a little bit more to your revenue model? I know you mentioned it's $1 a month for customers, and then you charge the governments, but where's the bulk of your money coming from? What's your path to profitability?
Absolutely. We are raising grant right now. We built a business. We tried to raise money. We were unable to do so because the customer cannot pay. So we lowered the barrier to collect data. And that data is highly interested. The government is highly interested by that data. We partner with Livelihood Impact Fund and Find, and another organization in Guinea called Rio Tinto to bring about revenue in terms of insight with the data that we are having. So for example, we distributed rapid tests. We have done COVID-19 rapid tests for over 5,000 people. And then we distributed eyeglasses for over 7,000 people. This is because we have the data, and instead of them coming into our communities and trying to figure out how to do this, we can share the insight and use the network of community health workers to help them.
Thank you. I have one additional question before the next one. So you talked about data. How do you manage people's data and cybersecurity?
So we are following the African Union data protection law, which is highly inspired by the GDPR. Guinea has ratified on that. We do not share any personal information. We share only aggregated data that give people to have an insight about what is in the community. For example, what is the income of the people? Who has clean drinking water? Those are the type of aggregated data that we share. All the other data is sitting within the Ministry of Health, which is the primary proprietary of that data.
So you're looking for 3.2 million. New customer acquisition costs about $6.50 each. What's the return on investment? What's your margins, and what would we be getting for that?
We will be building infrastructure. We are in rural Guinea, where you don't have electricity, you don't have connectivity. We are partnering with the largest mobile network operator to build that infrastructure, so we can ride on that infrastructure to scale across the country. Right now, where we are, we have to bear the burden of solar. We have to bear because there is no electricity. Sorry about that. It's impact. So impact first, right? And then financial return second. Yeah.
Thank you. Let's appreciate them. I like the honesty that for you it's impact first. And I think if I had money, I would give you. That's a very compelling story. Thank you. So next we have Helium Health.
Good afternoon, everyone. My name is Jean Kula. I'm the regional lead for Helium OS across East and West Africa. I'll take you through our presentation. So I'll stick a couple of slides so that I stick to time. So who are we? Helium Health is a digital health company. We have presence across 3 different markets, and we're really accelerating Africa's transition to being tech and data-driven. So far, we've been able to reach 1,000 healthcare providers in the different markets that we're in. That's over 12,000 health workers onboarded and 1 million patient records digitized. Oh, sorry, you can take the picture. And then with regards to our products, and I'll spend a bit of time on this slide, we innovate around these 4 main areas. So the Helium OS, that's the baby that I look after. Electronic medical records. And of course, because we're headquartered out of Nigeria, we had to understand the importance of innovating where digital infrastructure was an issue. So we built the platform to be offline first. And yes, Steve, we are HL7 fire compliant. We also have patient records and appointment booking. Our second product actually was launched in the middle of COVID. We were going out and trying to pitch our EMR, but facilities did not have the financing, and so we came up with Helium Credit, and I spoke about this yesterday. We've been able to lend over $10 million, and we do that on our platforms to about 300 facilities. Public Health Solutions, which Dr. Bosola looks after, we work with amazing partners like MSD for Mothers, Bill and Melinda Gates Foundation, HTHA, the Global Fund. And this really is where we see most of the impact, being able to reach healthcare workers, being able to reach patients and users. And with regards to our data and insight solutions, using predictive analytics to be able to inform, help decision makers make informed decisions. So with regards to our ask, I'll pause here and say Helium is not actively fundraising at the moment, but what we are looking for is partners who want to work this journey with us, specifically in the public health solutions. So in Nigeria, there's 1 doctor for every 5,000 people. Who knows what the population of Nigeria is? Exactly, in the millions. In Kenya, it's about 1 doctor for every 1,800 people. For us to reach the WHO standard of about 1 doctor to 600 people, it would take us 79 years, an entire lifetime, to train 237 doctors in Nigeria alone. We won't achieve that. We can use technology to help us shorten that period. So what we've done is we've built a new solution. It's our proprietary AI solution. Of course, everyone's talking about AI. And we're using that to help us bridge the gap where you don't need a doctor in the room and people can still do their consultations. So it uses silent listening, and there you're able to use the AI to then do a medical consultation. So what we are asking for is partners who are looking to come on board with us and help us build out the solution, integrate it into our OS, help us reach hard-to-reach areas across Nigeria so that we can bridge the gap. I'll also invite my colleague, Dr. Bosola, to also add on to our public health asks.
It's a tag team. Okay, so for public health, what usually happens is there's an RFP, and then we come together as a team and deploy solutions. And we've been talking about the pilotitis. So we have a couple of products now that we have developed that can actually drive impact, but of course we are constrained because we need partners to support. One of it is around our antenatal risk stratification. We've been able to do that for pregnant women. And also more recently, with the support of the HealthTech Africa Hub, we are now doing HIV/TB. So we're in a space where we are moving to preventive care because it's actually very expensive to deal with curative care and mortalities. So what we are really trying to do now is to be able to penetrate more markets with this, our solutions. So we have a couple of solutions like sitting on the shelf. We've used them, but we know that they are beneficial, especially like the antenatal risk stratification. A lot of people when it comes to healthcare, the hospital is not the first point of care, and you have most maternal mortalities are happening within the communities. And so we've been able to bridge the socioeconomic gap by building this antenatal risk on feature phones using USSD, and for those that can afford it, on web-based platforms. So they go through a couple of questions, and we build this advanced risk stratification algorithm that is able to tell them you're low risk, you're high risk, you need to go to the hospital now. So anyone who is ready to partner with us, we're very happy to be able to scale this and bridge the mortality gaps in Africa. Thank you.
Thank you. So we'll take 2 questions in the interest of time.
Thank you. Very clear presentation. I think a number of us who've known Helium Health for some time. So one, you don't need capital, that we understand. You need partners. Now the question is, where are you in terms of geography on the continent so far? You mentioned Nigeria, but your solutions, where else are there? That's question number 1. And I have a related question. How far are you in Francophones?
Thank you for that question. So we are in 7 different countries across East Africa, West Africa, and the GCC region. So we're in Nigeria, Ghana, Kenya, Uganda, Senegal, Cameroon, UAE, and Qatar. With regards to Francophone, we did actually have a partnership in Ivory Coast. We are still looking to expand that, and we did meet with some of the Ministry of Health officials a few weeks ago. Our platform is available in French, at least the EMR solution, and it's very easy for other solutions to be built in French as well.
For the focus areas that you were talking about in the public health space, like, or the public health type of like access to those kinds of services, are you looking to develop those solutions in-house, or are you also open to partnering with some of the existing solutions that are out there in the Nigerian ecosystem, for instance?
Yeah, absolutely. We are ready to partner. Integration is very important in that ecosystem. You can't solve all the solutions, and that's why for us, APIs, using FHIR standards and interoperability is part of the compulsory requirements for every product that we build. So absolutely, yes.
With scaling to these new areas, are you running a single hosted server, or do you install new instances in every country you're in?
I'll take that one. So depending on the markets that we're in, so with the data governance, with the data policies, if the markets that we're in are very strict about data sovereignty, then we do have like an in-country installation. And with our partners that we announced yesterday, Signalytics, it's amazing because they enable us to have microservers in-country. So it really is dependent on the product that we're offering. But for most of our data, we do store it on the cloud.
Helium Health. So that's the first startup I've had that is not looking for money. So that's a good. But you can tell us who you are acquiring or what startups you're looking to acquire. Next up, we have Isola.
Hello. So my name is Ruth Muthui, CTO of Isola. Let me start by saying this is so nerve-wracking. I'm used to being behind the scenes, but yeah, we are doing this. Okay. Isola is a health tech startup, and we're in Kenya, and we focus on simplifying the neuro health journeys of families affected by autism and other related conditions through empathic AI. So what we do is we develop digital health solutions to support these families to get access to affordable care and care resources. 1 in 25 children is diagnosed with autism in Kenya, but after diagnosis, it's very challenging to get therapy services. To begin with, the cost of therapy is pretty expensive. A session can cost between $20 to $60, and it is rarely covered by insurance, meaning many families cannot afford this. On top of that, it is hard to find good therapists around, especially those who can do early interventions for children. And then not everyone has access to these facilities or therapy centers, especially those living in rural areas. So Isola, we've developed a comprehensive solution to support these families. First of all, we've developed the Isola therapy platform to provide these families access to qualified therapists who offer personalized therapies, and they can access this virtually or in person at their homes or in school. We've also complemented this with our Zaidi AI Life Coach. It's a mobile app that provides personalized expert advice and real-time support from the licensed therapist. So that means they get daily tips to help them manage their day-to-day challenges. And the good thing with our solutions is that they are powered by AI, meaning we are able to deliver digital therapies more efficiently and also at a lower cost than traditional methods. As the awareness for autism increases, so does the number of children getting diagnosed, and that means they will require therapy. And this is the perfect time for Isola to step in and meet this urgent demand. The market opportunity is massive. In Nairobi region, there are 73,000 neurodivergent individuals, 1 million across Kenya, 3 million in East Africa, and globally, there are 75 million individuals who are affected by neurodiverse conditions. What makes us stand out is our hybrid approach. So we've developed a well-rounded solution to support this family, starting with providing them different solutions, the home-based therapy, the school-based therapy, virtual therapy. We've created a community for caregiver support, additionally providing them with localized, reliable information and this information is tailored for every region through our Zaidi application. Let me skip this. Okay, sorry. We generate revenue through multiple streams, starting with subscriptions through Isola therapy platform and the Zaidi app. Additionally, we get therapy service fees from our therapy center. And then we generate revenue through offering tech services, especially to our parent organizations. We are still new, so most of our revenue is from there. And finally, we are actively pursuing partnerships with different governments to offer digital therapy solutions and public health initiatives. We've seen good progress so far. 2023, we've earned revenue of around $73,900. 2024 so far generated revenue of over 101K. And the projections for the next 3 years, 2025 we project 202,000, 2026 506, and 2027 around 1.5 million USD. And we do see that our user base is steadily growing. For example, through the Zaidi app, we launched this application in November 2023, and we got 16,000 downloads. And that shows that our solutions are getting noticed and they have a strong demand out there. So for our growth strategy, we focus on Zaidi and the therapy centers. We launched in 2023 November. 2025, our plan is to grow and access other markets in East Africa, and by 2026, we scale across Africa. For the therapy center, we're officially launching the first one in Nairobi, 2025. We are expanding our services and growing the client base. 2026, opening new centers beyond Nairobi and into East Africa. So we are currently seeking 3 million USD to help us scale our growth, and these funds will be used to support our hybrid therapy model. So the use of funds is as follows: 25% in marketing and sales, 30% operation expenses, 20% infrastructure and equipment, 25% in technology. So our team is comprised of our CEO, Dr. Amuyu, myself, and Dr. Leah, the Chief Medical Advisors. So these are people who have a lot of years of experience, and we know that with these people we can go far in the organization. So to close, let me just say, I'm glad I got here. But yeah, so with your investment, we can scale across Africa, and we'll be able to touch millions of lives. Thank you.
First, well done. Stay here. Stay here. We have questions for you. Stay here. Don't go anywhere. So thank you for making the effort. We made it. So I have a question for you on your competitive landscape, notably on Roche. I was very surprised to see Roche, a major company in your quadrant. Yeah. Why Roche? If you remember. Nah, okay, no problem. No. So why are you opening the therapy center? Because you're supposed to be a digital solution. Why are you doing a physical solution?
So after listening to our clients, the feedback that they've provided, there are those who prefer coming to a center and working with therapists. And some of these clients cannot afford the tools, like for example, the DIY tools or the toys, but our therapy center will have all of those. And it will be hybrid, so they can come in and access the tools. It's more like a therapy hub. It's like a cyber again. So they can still access these therapy sessions online for those who don't have the smart devices and all that.
Lovely presentation, thank you.
Thank you.
Quick one, you're talking about AI using, how are you mitigating any risks of bad information that's going to be punitive to the patient? Who goes to jail if AI gets it wrong?
Yes, thanks for that question. So AI, we use it mostly in our Zaidi app, and what we do is that we've trained our chatbot with our own data. So we've collected data from relevant and accurate sources, and through that we are able to regulate what content is shown out there.
Can you talk about the impact? Because you talked about I don't remember, but like how many patients you've served, but what are the outcomes you're seeing from those that are served?
So far we've worked with 215 clients. 80% of these access regular therapy, and so far there are clients who we started with scholarship session, and you could see after the scholarship session ended, a lot of these parents came back and they came with their testimonies of how their children are improving and achieving their key milestones.
Another round of applause for Rose Mudui. What I like about your presentation is inclusion of neurodivergent children, and showing that you can actually make a business model out of it, which is also similar to the next company that is coming up, Therapeutic. I think they are all addressing these kind of special needs. So let's applaud Therapeutic as they come on board.
Hello everyone, I am Ahmed Al-Qabbani, the founder and the CEO of Therapeutic. This is Mariam, a girl from Egypt diagnosed with Erb's palsy, a motor disorder that affects her arms movement since birth. By providing her with more engaging therapeutic experiences, she has become more committed to doing exercises on a regular basis, and this eventually results in 80% improvement in less than 2 months. We are Therapeutic. We disrupt rehabilitation through immersion. We impact the lives of millions of families around the world using a science-backed, patent-pending approach and a technology that has ripened enough to disrupt several sectors, including healthcare. There are over 100 million children worldwide suffering from different types of developmental disorders. Over 2 million children in Egypt alone suffer from at least one type of motor or a cognitive disorder. More than 9 million children in US and Canada alone suffering from or on the spectrum of autism, ADHD, and dyslexia. This is primary health care. And the challenge is growing, resulting in a lifetime cost that can reach up to $2.4 million and tens of years of therapy for one person to lead a normal life. We can do better. Actually, we should do better if the numbers are on the rise worldwide. And in this context, the potential of virtual environments for rehabilitation is limitless. Through virtual environments, children can be exposed to scenarios and activities that are very hard, almost impossible to replicate in real life. And that's why we propose Therapeutic, a new hope for special education and virtual rehabilitation. We bring the full potential of virtual reality to therapeutics by providing effective, immersive experiences to instill motor, cognitive, and social skills in children. We provide our software as a system that empowers specialists to deliver supervised VR therapy sessions through which they can control every element in the VR environment through a real-time synchronization between a headset and a desktop app. They can assign modules to children, get real-time data collection and assessment, and visualize children performance data. Currently, we have 3 umbrellas or 3 types of modules. Modules for attention skills, by which we address children diagnosed with ADHD, autism, and dyslexia. Modules for motor skills, by which we address children diagnosed with cerebral palsy and other relevant motor challenges associated with Down syndrome, and modules for general physical therapy. This is a screenshot of our Ubrifi, our all-in-one therapeutic system, through which specialists get access to performance data and analysis, and based on which they can design and modify therapy plans. Why therapeutic? We transform a whole family's lives through transforming their rehabilitation journey. Based on our system, using our system, we guarantee at least 400% increase in the available training scenarios per session. This results in at least 200% increase in committing to training, which eventually results in 45% rehab cost reduction. Taking into consideration the huge variation between the therapy cost across different countries, from around $20 per month in Egypt to around $200 per month in the USA if you are covered by insurance. Our business model is a 1-month trial period that is comprised of a freemium for 1 week, followed by $250 as a flat cost for 3 weeks, up to 10 kids, after which we have a flat cost of $30 per child per month, so a monthly subscription. To go far, go together, we have collaborators in Egypt, Faculty of Physical Therapy in Cairo University, with which we have already started to publish articles that refer or indicate the efficacy of our products. We are also collaborating with the National Center for Special Education under the sponsorship of UNICEF in Vietnam. This means that we operate in 2 countries. We currently work with 8 therapy centers, 550 children, and we generate $6,000 as a monthly recurring revenue. This bar chart shows the growth of our users throughout the past 4 years. By 2026, we aim to expand to 7 countries, so 2 countries plus 5, with a special and strong focus and interest in Africa, to reach 100 therapy centers, 2,000 children, and generating $100,000 as a monthly recurring revenue. This is our team, a group of developers, researchers, and artists with over 50 years of combined experience, in addition to a stellar group of advisors in all aspects of the business. We look for partners, especially in Africa, with governmental bodies in general, to do pilot deployment and training, and to accomplish regulatory sandboxing as well. And we are looking for funding. We raised $200,000 in order to complete our pilots, to do some team expansion, and implement our IP strategy. Thank you.
Mike, okay. Thank you very much for your presentation. Shukran. Two questions actually. One is, why only $200,000, considering the scale that you want to achieve? Your fundraising.
Yeah, 200,000.
Yeah, 200,000.
Yeah, 200,000.
Why only 200,000?
I don't need more than that.
That's good answer. I like that. And the second one is, why you setting it up? What's your background?
My background is electrical and computer engineering. and my PhD was on virtual reality. But I wanted, after defending my PhD, I wanted to incorporate my knowledge in something with a social impact. So that's why we started Therapeutic.
Thank you.
Thanks for that. Could you speak a bit to sort of how you would scale the product? And it seems like you need a VR device, right? So how much does that cost? What do your margins look like? If you could speak a bit to that.
Yeah, of course we need a VR device, but the good news is that we want a piece of equipment that is getting cheaper, that is getting smaller or more compact, and that is getting more strong in terms of computations. So the future, I can say that I envisage a better future for VR devices within the therapeutic landscape. This is number one. I'm sorry, what was your first question? The first part of the question.
How you would scale, basically.
Yeah, another good thing about our journey is that we have learned a lot regarding how to scale or how to adapt different modules. For example, we develop the core of the modules once, and from this point we can adapt it to different types of skills very easily. I can say that the adaptation doesn't take more than 1 to 2 months or working months. This means that we have a good potential for scalability, because we can target with the same set of modules multiple disorders or multiple types of skills to instill in children. In addition to that, we are building our IP strategy on something that distinguish Therapeutic from our competitors regarding the integration with different biosensors. We believe that integrating different biosensors with our VR modules would enrich the experience, would allow us to get better results, and of course would secure more users to our solutions. Did I answer your question? Okay. Thank you.
All right. I was curious as you're speaking why you don't partner with Isola, so that since you're conquering a similar market segment, and you can cross-sell each other's products. Next on, we have MedPharma.
Good afternoon. First time in Kigali. Very nice country. Thank you very much. I'll start with 3 stories. First story, the CEO and founder of the biggest private healthcare insurance company in Ghana, Premier Health, had the child at ICU. And literally, it was a life and death situation. And they needed morphine sulfate. They had been looking for morphine sulfate for a while, they were not getting. So he called me on the phone. I was in a meeting. And guess what, within 30 minutes, we got it for him. The second story, I had a friend whose wife needed a neurosurgeon. For about 2 years, he actually thought there was no neurosurgeon in Ghana. He called me one time. I said, don't worry, I'll get it for you in 30 minutes. He had his consultation. The third story, EcoBank during COVID was quite worried how they were going to manage COVID and their staff, because he needed 2 weeks break period. They have to come back and test and all of that. And they contacted us, and that's when we pivoted into e-consultation. So these stories gives you an idea of what MedPharma is trying to do. We're trying to reach out over 100 million Africans, not just in Africa, but the whole world with our solution. The problem some of my colleagues have already mentioned, in Ghana, the doctor-to-patient ratio is 1:13,000. And also, if you have a prescription of 5 drugs, chances are that you will probably just get 2 in a pharmacy and need to go to other pharmacies to go for them. So we're developing a SaaS, basically a solution. We have a mobile application which makes it possible for you to have e-consultation, e-prescription medicines delivered to you, store your medical records as well, and store your medical records as well. This is our Tamsum and Sam. We are currently focused on Ghana, and in Ghana, we are particularly focused on the out-of-pocket market, which is a $1.2 billion market. We have opportunity to work with the government, but because government doesn't pay early, we are shy. But maybe in future, we'll get there. These are some of our competitors. I don't want to belabor the point here. This is how we've tried to grow through partnerships. So this is basically how it works. You go onto the MedPharma app, which is on iOS, Android, or our chatbot, and you basically can request for your medication. You can ask for your diagnostics. You can get your e-consultations, and it's all delivered within the app. We've also created special products. So we have a remittance product called Westcare. So if you look at Ghana, about $4 billion come into the country on a yearly basis. 25% plus of that goes into healthcare. And we think that's a huge opportunity we can tap into. We actually have clients like that, but we haven't really doubled down on it. Then we have PregCare for pregnant women, 9 months. We can basically do e-consultation for you, deliver your medicines for you, and all of that. Then we have a subscription product, which I'll touch on shortly. I've given you use cases of our product. This is how we make money through consultation, prescription, delivery, diagnostics. Then this is our roadmap. We're looking at touching about 100K customers by the end of this year. In terms of traction, don't mind the Ghana cedi. It keeps fluctuating every year. So in real value in dollars, we've done in excess of $1.3 million to date. But we've touched over 1 million. We've delivered 1 million drugs, over 300,000 customer touch points, over 60,000 unique customers, more than 60,000 consultations. And this is the big guy in the room, 15 million. We've unlocked a 15 million customer pipeline, and I'll address that. It's with a big guy in the room, MTN. We just signed a contract with MTN, Scancom Group in South Africa. So MTN is actually looking at entering into the healthcare space, education and security as well. And maybe we are that bad enough, they selected us in Africa to lead this for them. So in Ghana, we are piloting this project with MTN to unlock MTN entering into the healthcare space. Once it's successful, the idea is basically to double down to other MTN operating countries in Africa. This is how traction looks like right now. Big companies usually come and they bring you a lot of wahala. In Nigeria, it's like they bring you a lot of trouble, right? And they say, we need this tomorrow. So we started this conversation last year in October, but we actually got to doing it or implementing it in August of this year. And from August of this year to date, these are some of the numbers we've had. We've actually signed on the Ghana National Association of Teachers, which has about 200,000 plus teachers. We're currently talking to Complete Farmer, which has about 40,000 farmers. And we're talking to security companies in Ghana as well, and we're rolling them on board. So we're not doing bad. We're looking for 750K pre-seed. To date, we've basically bootstrapped. The Bill and Melinda Gates Foundation through the I3 gave us 50,000 grants last year, so it's helped us enough. But these are the areas we're basically looking at putting our monies to. And I'm happy to say, just this morning, I had a call from one of our suitors who is basically trying to lead this round with a significant amount of money. So at least we are in a good place once I sign that term sheet. In terms of the people behind, I'm the chief servant, and we have about 10 doctors, 15 doctors on board, and we have our superintendent doctor, that is Dr. Harris, and we have our superintendent pharmacist, which is Angela. Then we have our own development team, which is just 2. So everything we've done is basically internal. We have Maureen who and Ashwin serving as our advisory board members. And these are some of the partners we've also worked with. And these are other partners we've also worked with. Thank you very much.
Let's appreciate him. So we have 2 minutes of Q&A.
Great presentation. Love
Thank
where
you
you're
very
going
much.
with it. You're running, what's your cost per subscription?
What's mine?
You've mentioned you sell subscriptions. How do you cost
the
them?
MTN one?
Yeah.
Okay, so for the MTN one, we have 2 products. We have the silver product, which is 10 Ghana cedis, which is like 70 cents a month. And you get telemedicine benefits, so you can talk to any doctor, you can store your medical records on the platform and all of that. But you also get a life cover of 4,000 Ghana cedis, which is like maybe $250 a year. So if you get hospitalized, you get 100 Ghana cedis a day for 30 days. Touch wood, if you die, you get 1,000 Ghana cedis. But it is underwritten by Sanlam Alliance Insurance. And we have the gold package, which is 161 Ghana cedis a month, which is like $10 a month. And you get all the live telemedicine benefits I listed. But on top of that, you get 26,000 health cover, which is like about $1,005. So you get OPD cover, inpatient cover for surgeries, eye, dentistry, and all of that. The good thing about the product is, in Ghana, traditional health insurance, you basically pay upfront. But what we've done with this is we've done the sachet model. So you pay on a monthly basis, and the benefits are aggregated as you pay. And once you pay the first one, you can quickly get access to the service. You can basically book. So as I speak right now, there are people who are having consultations on the platform, and I'm tracking them. And I hope they are happy.
That's great, thank you.
It means I didn't do well.
No, then I have one more question for you, my panelists. So, you're looking for $750,000 investment here.
Yeah.
What are you offering in return? Is this equity or is impact? Where are you aiming?
So we're pretty much flexible. We want to do equity safe, direct equity or safe. We are pretty much flexible. The lead investor we're currently talking to initially wanted a direct equity, but they are opened up to safe right now. So that's where the discussion is going. Thank you.
Thank you so much, and congratulations on the raise. Hope you close. Next we have MedTruck. MedTruck, are you in the room? As we wait for MedTruck, maybe we can have Honor Kenya.
Hello, my name is Dixon Ukanga. I'm from Honor, Kenya. I'm a software engineer by background. Here to talk about OpenSRP2, our patient-centered point of care solution for integrated primary care. As a company, we've been around for over 10 years. Just hit 11 years this year. Our focus has always been, we want to use data, we want to use digital health to be able to impact lives and be able to change lives. Through that process of building, there are some challenges that we do encounter, one of them being healthcare delivery is quite fragmented. This is usually because of a lack of interoperability. It makes things a bit challenging. It leads to poor patient outcomes. And primarily because in this case you don't have coordinated care. A second challenge that we also face sometimes, if you really want to build really good apps, is that we have to implement really complex logic to be able to meet those needs that health workers need. This will sometimes make the process of building that a little bit difficult, expensive to build and maintain, because you sometimes have to maybe hard code or build a single application for each and every intervention. We are aware about this because with OpenSRP1, which we built for about 8 years, we've been going through that process and we've experienced that. Our process as a company is we always want to solve the problem in one soup so that we don't keep going back to the same challenges. Over the last 4 years, we've worked with WHO and Google to be able to build a standard-based configurable application for digital health. what we expected to get out of it is that it is interoperable, that it avoids vendor lock-in, in this case, governments and institutions invest on standards instead of platforms, is already fire compliance. But a key thing that we also were able to achieve was we now have an application that what you need to focus on is only building the content. The content here being workflows, being the data itself, the data model, and you have an application that's ready to pick it up and run it. And this is based on the HL7 fire standard. This is what we call OpenSRP2, Digital Health Platform for Integrated Primary Care. One of the things that is also cool about this application is that in places where we don't have connectivity and community health workers are working in the field, they're able to share medical records and be able to continue providing care until the time they get back to connectivity. We've been lucky enough to have quite an amount of significant impact. In over 10 countries, we've been able to register over 90 million clients with OpenSRP in general. With OpenSRP2, which is a venture we started, as I mentioned, 4 years ago, we are live or going live in 6 countries. And we already have applications in different health areas like CHW, mental health, supply chain. And we've had the opportunity to be able to train technical partners, because it's also equally important. And recently, we had that opportunity to do with the Minister of Health in Peru. Our revenue, as you see, with OpenSRP1, steadily grew until the time we started focusing a lot more on OpenSRP2 development, invested heavily on the product development, and now we have tools that's ready to go to market. We started that process, and we're expecting that to start climbing up again. If you take, in this case, the goals for OpenSRP2 to be able to have a standard-based configurable solution, we've achieved that goal, but we still have some challenges. One key challenge is that development still takes a long time. The other key challenge is require quite a lot of technical expertise. And we are seeking to address these 2 challenges by leveraging generative AI so that we can reduce that. Our internal testing already shows that we can reduce weeks of work to 2 days of work. And in reducing, through that process, we're able to reduce the technical expertise. A key thing that governments require is local ownership, and we expect this will be possible. We are seeking to raise $3 million to tackle building build a platform that leverages generative AI and other functionality like billing. We also want to grow our global partnership. It's increasingly important to focus engagement with governments, and governments require engagement with local partners. That is increasing a big requirement with governments and donors. So we want a program that will be able to help with that. And hopefully, we expect to expand into the private sector and middle to high income areas. Yeah, thank you.
Let's appreciate him. This is the first startup that has said they are fire compliant. So the session that was here earlier, standards and interoperability team, I hope you note that. So we have 2 minutes of Q&A.
Yes, thank you very much for the presentation. One, two questions. Who are your competitors? And number 2, where is the team?
Yeah, in terms of competitors, IntelliSoft is technically one of them, among others. Solutions like DHIS2, Medic are competitors, But one thing that the approach to building this solution is if they build on a platform, they have the opportunity. We want to build a platform that solves the health solution. Someone does not have to figure out fire, but they should be able to build a fire application and start using it and have interoperability. They focus on the problem and not necessarily the challenges in dealing with the standard. Two, our team is in Kenya, Nairobi, most of it, but we have people split around from Iceland, US, we are quite global, even Indonesia, we have really young people that are there working there. Yeah, but we operate globally. We are trying to conquer the world in a way through a global good. Thank you.
It's actually a really nice full circle thing. I got my start at a company that I think supported you guys, but my understanding is it's mostly been sort of like a multilateral initiative, right, with OpenSRP. So do you have an ongoing kind of, like, what's your revenue model in the future?
I don't think it's been multilateral. We've worked, yes, with NGOs, international NGOs. We're actually technical partners. We've built OpenSRP from ground up. The reason WHO was involved is they wanted a reference application for WHO smart guidelines. We built that. Countries can pick that to the smart guidelines, like let's say the immunization module, and customize to fit their needs, and be able to run that on OpenSRP right away. So it simplified that particular process. Our revenue model so far has been solution-based. We get projects, we deliver, and we get technical support over the years because we deploy these systems in country, in facilities. We work in facilities that are usually in hard-to-reach places, not necessarily the big facilities. So that's something that we do quite often. Thank you. Sorry, the other bit, the other partner, Google, is primarily because of OHS, Open Health Track. They are building the FHIR SDK, and we are primary consumers and contributors to the FHIR SDK. And that is a platform that is helping anyone that's building FHIR, especially on Android, to utilize that library and make use of that. So we are kind of the test bed for them to be able to make sure that it is able to meet the needs of innovators that want to build on FHIR, especially using OHS. Thank you.
Let's appreciate him once more. Thank you so much. Next we have Tansmed. Tansmed in the room?
Hello, good evening, everyone. My name is Nyoni. I'm the CEO and the founder of Tansmed. So Tansmed is East African platform, which is a Swahili platform which simplify healthcare accessibility in East Africa and Africa in large. So in Tanzania and many parts of Africa, we are facing almost the same problem. Is healthcare accessibility has been a big challenge. And this challenge came across a lot. First of all, like professionals are not enough. And even if you find those professionals, because of the populations, they are very busy, and even the quality of care is also a challenge. So most of us go to the hospital, we talk to the doctor, but what we are getting is a little bit, compromise. And not only that, even the prices, it's very expensive because I used to joke with the people here in Africa. We are getting sick too much, and people are, because like in Tanzania, if somebody passed away, say God loves more than what we do. Yeah, so that is the challenge what we are passing. So for Tansmed, what we are trying to build, healthcare super app. So this is a marketplace whereby you can do everything with your health. So our platform is not only like you can access Tansmed to talk with the doctor. As you can see, it's AI powered. So you can talk with the doctor, which we call Amina. Amina is a Swahili language, which means Amen. So why you call it? Because this is AI model whereby it gives you blessing, right? So blessing for your health. So you can access Amina, and from the Amina, it can give you direction where to go, what to do, and it can link you with the tools. As you can see, we have digital tools with a lot of personalized tools. And if you need to talk with the doctor, it can link you to the specialists. We have more than 7 specialists now in Tanzania. And at the same time, if you need a human doctor, it can also link you to talk with a human doctor. Not only that, we have incorporated a mental health tool whereby, I think this is one of the very first tools whereby you can do assessment of your mental health. A lot of people here, when you ask them, when was the last time to do assessment for mental health, they tell you, I know me, I cannot have a mental health challenges, right? So this tool, you can do assessment, you can track your mood, and at the same time, you can link you to the professionals. Not only that, you can even create goals. And through those goals, you can track, and we incorporate this tool with very low, because we're working with the hospital, we're even working with community health workers. So there are some, because we know these services are very expensive, so we are linking them to the people who are very near, because our main focus is preventing people getting sick. That is one of our major priority. And if you get sick, at very early stage, we link you to the service provider. So this is how we make money. Transmed, we are multimodal. We have multimodal revenue streams, whereby we have subscription. This is for B2B, because we're charging hospital to receive appointment through our platform. At the same time, for user, they can have subscription so they can unlock other services, and they can have premium services. We also have on demand, if you want to chat with the doctor, if you want to have consultation, which is via telemedicine, which is hyper compliant, we can also do that. And very soon, we are going to launch our e-lab and our e-pharmacy platform. So since we launched, there's a very big journey of Transmed, but I'm just taking for since 2021. So since there were, before it was more impact-wise. We were not focusing on B2C, we were focusing to B2B. Since this year where we opened B2C, so we generated 400,000 US dollar, and up for now, our month revenue is 12,000 US dollar with increment of 37%. We are also recognized by a lot of brands, including this year, we are the regional winner for the India's Global Startup Award. So we are representing East Africa. And in November, we'll be presenting, competing for the Africa region. We're also working with a lot with, thank you, HealthTech Hub. They've supported us a lot. We work with the Aga Khan Hospital in Tanzania. And we are also working with the Mirembe, that is the National Mental Health Hospital, whereby in Tanzania, there are only 42 psychiatrists, and up to now, 12 are available through Transmed. Also, without forgetting Grow Africa. So the Transmed, why this? This is only in one, as I say, it's a marketplace for everyone. And we launch, and people are using. Even if you go to our platform, you see a lot of interaction. Myself, I'm the CEO and the founder of Transmed. I call myself IT manager. Also, my background was from networking. Then he changed from IT manager. We have Dr. Nauma. This is a doctor we know with him since childhood, and me was the one who called him doctor. And now he became a medical doctor, and now we are making things happen. We have Dr. Mhawila, who is the CTO, is also my middle school classmate. So we friends making impact and making life very easy. This is our advisory board. We decided to scatter different specialities from the business, from the medical, from everywhere. And so now we are raising 1 million. We've started this October. We are expecting to finish next year. So our target only for number one, we have to unlock one of our new feature, which is safe in medical records. We want to be able user to store the medical records and the vital using the face self. And not only that, as we speak right now, Tanzmed, we are in three countries, Tanzania, Kenya, and the Congo. And you'll be surprised, like, as I mentioned, our biggest user base is in Kenya while we are in Tanzania. So that's the power of digital technology. But now we want to go ground there. Yeah, and the last thing, we need to increase the user base, and we need money to make more money. So that is about us. This is our initiative a lot, even with this picture here, when we launched the first time, we supported by the Tanzania Commission on Science Technology, and a lot, that's when I pitched. I was among 3 companies which pitched at US state for the MCC Millennium and in HIV AIDS. Thank you.
Thank you so much. You have 1.5 minutes of Q&A.
Thank you.
All right, I'm going to go back to my AI aspect. You're doing AI suggested support or assisted, what did you say, AI assessments. How are you training that? What model are you using? And where is that data coming from?
Okay, thank you. So for the AI, we have two parts. The first one for the general health, and the second part for the mental health. So for the general health, we have our own data, which we train, which, because Tanzmed, it started like since 2017. So we had the charts, we have a lot of data. So that's number one. But for the mental health, we didn't have enough data. So what we did, we just used the normal ML for understanding the user, and we used the existing tool by the Ministry of Health to go through, to take user through that tool. So that's what we're doing.
The $1 million that you're asking, what form are you looking for? Is it equity or?
Yeah, it's equity in SEF.
Equity, okay.
Yeah.
But if you get grant, you'll not say no, eh? Let's appreciate him. Next we have TC4A. TC4A in the room? Good luck.
Good evening, everyone. My name is Felim Nyabuti. I work for a company called Take Care for All, where I serve, as the partnerships lead. So we are in operations and headquartered in Nairobi, Kenya, with operations in other countries like Uganda, Rwanda, Ghana, Senegal, and Nigeria. So, what problem are we looking to solve? I'm sure we are all aware, especially if you're in the healthcare industry, we do not have enough number of well-trained workforce, which has really created such a huge gap within the industry. And number 2, Africa being a secondary market, usually innovations within the industry get to us way later than the rest of the world. So our journey started with a focus on improving trainings for healthcare professionals, where our flagship program called Medical Learning Hub, we offer curated medical content that is free for access for all healthcare professionals, with organizations paying for them rather. Another way we are doing this solution we are offering is through our channels and our connections within the industry. We are enabling organizations looking to expand into the African market, navigate that. I had mentioned Medical Learning Hub, which is our flagship product. It's essentially an e-learning platform with different capabilities, and I'm going to go just through a few of them, which include tracking of CMEs and training activities. We've also been able to integrate AI and are now able to generate learning content and also have automated the process of CPD approval and getting certificates. Currently on the platform, we have a very wide user case where we have 50K plus users and offer an array of different courses, serving different people like farmers, NGOs, and also hospitals. When it comes to market access, the approach we are using now is in 3 steps, really, where number 1, we are able to generate curated content alongside the innovations and then marketing it to our users. And then number 2, with our networks within the industry are able to link these different organizations looking to expand and support their business model testing while also guiding them through the different regulatory compliances. Another thing that we offer is tech support, where we've been able to integrate different solutions to our platform and allowing doctors to test them and seeing if they make sense. Here we have just a couple of clients that we are helping achieve that. When it comes to our business model, like I mentioned before, MLH is free for access to all healthcare workers, so all you just need is data connectivity and the courses are available to you. And then we have different organizations like hospitals who pay us to manage their CMEs, and larger pharma who also pay a subscription fee to access it all. Here we have a map of our physical presence across Africa. Like I mentioned, we are headquartered in Kenya and also serve the Eastern and Western African markets. When it comes to our revenues, we launched 5 years ago and we've been able to break even this year and looking to close the year at 900K. Currently, we've also have managed to sign contracts of approximately 2.9 million for the years 2025 to 2027, and are looking to fundraise an extra $2 million, which will, one, help us expand to more countries. We are targeting 4 countries annually, and also strengthen our capabilities and solutions while also investing in diagnostic tools. This is our team. It's locally led by Dr. Benson Chuma, who would have loved to be here for this presentation, but is currently on paternity leave and are spread across Africa. Thank you so much. You can reach us through this contact.
Thank you. That was fantastic. And one of the first teams to actually show us what your costs have been, to understand where you are, and really well done that you're breaking even with what looked like a 30% margin this year.
Thank you so much.
Very exciting on that. Yeah, that's really just a compliment on that side.
So, thank you very much for the presentation. I see a number of countries you are in already. What's the plan going forward with the beyond the 2 million?
So for now, we are trying to focus more on diagnostic tools, specifically tools focusing on antimicrobial resistance. Yeah.
Okay, thank you. Other questions?
Thank you so much.
Well, hang on. For the 2 million, what are you offering? Equity impact? What would you like from us?
We are very flexible, but are looking for equity safe. Yeah.
Thank you.
Thank you. Let's appreciate her once more. TC4A just went through Viugo Africa Investment Committee, I think last week, and got approved. So all these startups that are presenting are tried and tested and vetted. So if you're an investor in the room, don't shy away. Next we have Thalia. Welcome.
Hi everyone, my name is Dennis Mwangi. I'm the managing partner for Thalia Psychotherapy. Will allow me, Karine and Wilfred, to change the script a bit. I want to do the presentation in 2 minutes and do the questions for 5 minutes. Reason being, everybody has spoken about what we do. Everybody has said what mental health does. And just to continue where Tasmed ended up, how many of you have done a mental health assessment? Lift up your hand. That is exactly what you're trying to solve. So Thalia Psychotherapy basically is trying to integrate mental health into everyday life. How we do that, how we do that is we integrate mental health checks as part of the triage. So we want to ensure that all medical decisions, half of the medical decisions actually is our target, include mental health. How we do that is we empower the hospitals to do the mental health assessment. We automate it for them, and we go further than that and providing the actual support in terms of the manpower required to make the treatment. So how we do that, we do more of an Uber for mental health. I know most people don't like hearing that, but that's more or less like it. So these are our numbers at the moment. So we are in about 4,000 health centers. We are in about 5 countries. We have about 6,000 therapists, 4,000 unique customers. The reason why we have unique customers is because we have close to 6 million users that are on our system, but those that have done enough tests to be considered to have a complete profile is 400. We have 57,000 that are actually paying a monthly subscription. But the reason why we are here is because of the new universal health scheme that has come to Kenya, that we are trying to basically do mental health on behalf of government. And that is actually why we are here. And what we're asking for is $5 million to ensure that we reach the 12,000 hospitals that are in Kenya, and to ensure that basically mental health becomes as common as physical health. Yeah, that's 8 ends. So.
Very good idea. Thank you for the presentation. So, are there any other competitors in the market doing the same?
Yes, very many. And in fact, our idea is to ensure that we empower them. Mental health has actually, I don't consider them my competitors, because the market is over 90% of our patients are not receiving care. So I don't even need to look at my competitors. They're only fighting for 10%. I'm after going for the 90% that are not receiving care, which the numbers, by the way, is about, for Kenya alone, 16 million that require that care. We're only reaching about 600,000. So we need to change those numbers.
Thank you. Other question, which is more product. How do you integrate the mental health assessment as part of the triage? Because usually when you do triage, remove your shoes, step on the scale, BP, blood pressure, and then you're done.
Good question. So what we have basically done is, you see that 15 minutes you wait before you see the doctor. There is a special code you dial. Every hospital has a special code. We basically get empaneled to the program, and we ask you a few questions. And then after that, the system basically continuously prods you to continue doing assessments so that we are able to. So we enrich, remember the profiles I was talking about? That is exactly what is now being enriched, so that the next time you go to the hospital, they have a complete profile for you, but we start from that point.
So just really to understand, so that first quote-unquote creation of a profile is just a bait. Thank you. Okay.
Yes.
You said you use the code. Are you running an app? Is it USSD? What's your tech that you're running here?
We are actually omni-channel. So our backend basically can handle all those requests. But our main channel or our main gateway is the USSD and SMS. But we do have WhatsApp, we do have the chat, we have everything. Let me just put it that way.
I love that. Fantastic. And then you've got 57,000 paying customers at the moment. What is
sorry, that is subscription.
Subscription, 57,000 subscriptions.
Yes.
What is your revenue that you're looking at for this year?
This year we are about to we are going to hit about 1 million. Last year we did 600. And with the new government plan that is coming on board, we are hoping by next year to do 5 to 6 million.
All right. And have you broken even yet, or are you still?
Yes, we are profitable from day one.
Okay, fantastic.
Which was very important for us, because mental health, everybody looks at it as a charity case. We wanted to change that because it's part of the problem.
And in terms of scalability, you're
Yes.
focusing now, I think you say Tanzania. What's the opportunity to move it to other parts of the world?
Oh, sorry. What we're doing in Kenya, we're actually replicating in other 5 countries. In Kenya, we started with a pilot. Now we are doing the national. Right now, we are asking for permission. Actually, we're waiting for approval for Uganda, Ghana, Malawi, and Nigeria, Lagos State. So hopefully this solution will be, our target is to be everywhere in Africa, because as Tasman made, there are only about 20 psychiatrists. We want those to be able to treat a patient in Kenya and vice versa, where there's no issue. So we want to try and ensure we have a level playing field when it comes to mental health.
Yeah.
Just maybe could you talk about the team? like what kind of skill sets does the team member have? And
Okay. Our team is basically comprised of mental health professionals, myself who is in the IT, and right now we have actually included the actuary because we want to make mental health as part of the insurance offering. It's something that we're actually doing. So we actually have that as well. But primarily it's made up more of mental health professionals, marketers as well, and the IT side. But right now we are going more to the market. That's why I brought in the actuary as well, and more of customer-facing, customer service. Yes.
I have the easiest question. What's the name of your company? I totally missed it at the beginning.
Now, Thalia Psychotherapy. Now, she brought up something very important. Most people don't get our name. So that's why in most countries, you won't find us as Thalia. You'll find us as, for example, in Kenya, Mindful Kenya. When you go to Uganda, we are Mindful Uganda. If you go to Ghana, we are Mindful Ghana, and so on.
So why Thalia?
We are looking for a name that anybody in Africa can pronounce, which apparently most don't. Yes. So we are better known through our Mindful brand. Good question. Another problem that we face in Africa is because there's weak legal, what is it called, mechanisms. Anybody can basically wake up and say, hey, I'm a therapist. And nobody's going to follow that. So those are some of the things that we're actually doing. We are putting strict regulatory or strict standards to ensure those people that are actually offering mental health support are actually qualified to do that, because sometimes it hurts us more than it actually does that, because they also do, here's the thing, because you're not qualified, you offer cheap prices, you do the undercutting, which makes mental health to also look like one of those, yes, that's the word. So the vetting that we do actually depends also on the country in question. But like for Kenya, we have actually gone ahead and have the regulations in place. There's a new body that vets them to empower them so that going forward, Ghana is also on course to do that. So it's something that we are empowering. So very soon, mental health will have the standards in place that are required. Thank you.
Thank you so much. It means that if you are a mindful practitioner, oops, sorry, I was not mindful of my phone. If you are a mindful practitioner, then you'd put mental health, right? And if you're a mindful investor, you invest in mental health. Next, we have TPN.
All right. Good evening. Good afternoon. Good evening. Good evening. So before I tell you about TPN, I will tell you about the story of Martha. So Martha is a lady who walks into Dr. Joshua's office, and she's supposed to go through a procedure. And as they're conversing, they discover, oh wait, this procedure was actually done a few years back. And so upon further inquiry, it is discovered that Martha, at this point, has stage 4 breast cancer. She has a huge lump on her left breast. When she had gone for the procedure about maybe 2-3 years back, it must have been at stage 1 or stage 2 cancer. And so, who is to blame for the story of Martha? The entire system is. My name is Nancy. Dr. Joshua should have been here. He's our CEO and founder, but he is stuck in the UK, where we have just established our top company. All right, so looking at this global map, it is very evident that there's a shortage of pathologists across the world. I mean, just look at Africa. In developing countries, the ratio of pathologists to population is 1 to a million. In developed countries is 1 to 50,000. So you can see it's not a unique problem to Kenya, where I come from, but it is a global issue. And this shortage of pathologists most of the time leads to misdiagnosis, and delayed diagnosis. So what can we do about it? As the pathology network, we have 3 apps. We have a patient's app, a clinician's app, and a pathologist's app. And these 3 are then hosted by a core web application called SPES 360. SPES means hope. And so, in a nutshell, doctors are able to order for a test. Then it goes, we get a ping, and then through the customer service and logistics team, we are able to know where the test has been ordered. And then we have visual of the labs, and we know what lab has what capacity. Then we are able to take that test to that particular lab. Then after that, we are then able to assign either a digital slide or a physical slide to a pathologist, who then does the diagnostic reporting, and the ordering hospital or clinician gets the results. Our turnaround time is average 7 days. In a normal case, and just looking at mother's case, it could go up to a year, which is quite sad. In terms of traction, we've served over 30,000 patients to date. We're about maybe 5 years old, going to 6. Financial year, which coincidentally ends today, we are at about 200,000 US dollars. We have 300 plus clinicians on our system. We have over 100 hospitals, partner hospitals. We have pathologists in Kenya, Spain, Canada, and Australia. And we have 5 labs that we have partnered with. So where Dr. Joshua currently is, we got an endorsement by the Global Entrepreneur Program. And this was, a great opportunity for us to be able to open our top company in the UK. Our ask is 1.5 million as a convertible note. We want to strengthen our growth in East Africa. We are currently only in Kenya. We got some interest in Tanzania, but for us to be able to do that, we would need some bit of funding, and we also want to go into the West Africa market. But so for us to be able to do that, and also to incorporate AI into our diagnostic workflow, that's why we are asking for the 1.5 million as a convertible note. Thank you for lending me your ears. That's my time. I'm glad Vilgro and Jazarift are here, so they can answer some of the questions.
Exactly. I was going to say, let me not ask questions. I know the company very well. I'm an investor.
So, who are your competition in the space? And what makes you unique in compared to them?
So we do not have competition because of what we are offering. So we work with labs. So these labs have competition. So for example, let's say AAR as a lab, who is our partner lab. And then we have Lancet, who we are not working with. So in terms of distribution of tests across the country, for example, there are those that will go to Lancet, and they probably would have come to AAR, who is our partner lab. So we are not directly, we don't directly have competition from that front, but our value proposition is that there's no one else who's doing what we are doing in terms of visibility and coordination of hospitals, clinicians, and labs in the country. Actually, not even in Africa.
Can you talk about how you're generating revenue? What is the revenue model?
So we are B2B. We've also gotten funding. So this will be our second round of funding. And so we work directly with the hospitals. So the hospitals will pay TPN, and we will pay the pathologists, and we'll also pay the labs for the number of tests that have gone through the system.
And maybe this is a logistical question. How can a doctor based in Spain or Canada provide guidance for a case in Kenya, for example? Just maybe want to understand, are they allowed to do that?
Yes. So mostly we are partnering with those pathologists from, so sometimes we have difficult cases where, so for example, if a case comes to my desk and I'm not able to interpret because either of the stain and I have some questions, then we can have a round table with other pathologists and discuss what do you think and what do you think, and then after that we can come to a conclusion. Then there's also the issue of practicing and licensing, which comes into the picture. So we are also currently going to be working with SEAL to ensure that we are compliant from that perspective. But more so, there's something that is called a digital pathology. So it's like a normal scanner, but now this is for slides. So a slide goes through a scanner, then there's a digital image which then is dumped into a pathologist e-folder, and they're able to look at the image and diagnose.
Sorry, you said you had 300 hospitals signed up. Is that correct?
Yes, partner hospitals.
Partner hospitals.
Yes.
What's the time for client acquisition? Like, how long is it going to take to get to 400 hospitals?
So something happened recently. We are working with, we have partnered, not working, we are partnering with the Kenya Medical Research Institute and Mount Kenya University, courtesy of FIND. And so we are working on testing 1.3 million women for cervical cancer. And what this has done for us is that it has accelerated our reach to market, because then as we go sell, or quote unquote, sell HPV DNA, HPV being the cancer that is responsible for 90% of cervical cancer. As we go to the hospitals and speak to them about HPV, we are also selling the other tests, the other 9 tests that we have. But so we are looking at adding more tests to get to 100, but currently that's what it is.
Great, and then maybe one last question. Internally within your business model, what is the one thing that's your barrier to scale? Sometimes it's you need physicians on staff, and you would hire more staff. Like, what is that one thing that's going to stop you exploding?
In the recent past, it has been engineers. So these people are very expensive, and so they are very expensive. So just getting a few on board really, makes such a huge dent to our my payroll. And so, well, I would have had maybe 12 or 10 engineers. I end up with 3 who I can afford. So it takes longer for us to develop our tech. Yeah, that has been the main problem and challenge. That's why we are seeking for some funding.
Can you talk about data privacy and medical images being sent perhaps cross-border?
Sure. So we are compliant with the GDPR, and also we have the Kenya Data Protection Law and Regulation. So as any patient data flows onto through our platform, it is the element, what is it called? It's anonymized. So even as it goes to a pathologist, it's in a unique number that is only, that we are the only ones who would know. And so there's really no patient information that is going out there or which would leak. And yeah, our system is fully compliant from a Data Protection Act perspective.
So last but not the least, we have HealthX.
Thank you very much. Happy to be the last, which means my ask is all the remaining capital not allocated. So I'm Roy, I'm the CEO of HealthTech Africa. I'll be pretty quick, and I'll focus these 5 minutes on our business model. But first, some background. The world is becoming more African. You can see from the top there, Kenya, we donated Barack Obama. You can see one of the richest guys in the world, Elon Musk, is actually South African. But on a more serious note, when you look at this map of the world, the dark purple is where population is doubling. And you can see Africa really, the population growth is going to be massive. Africa in the 1950s used to be 9% of the world's population. By 2050, it's going to be 28 to 9% of the world's population. So there's huge opportunity with population growth. But what does the healthcare scenario look like? I'll take you through a case of Kenya, where there's 1 doctor to 4,000 people against a WHO recommendation of 1 doctor per 1,000 people. So access is a big issue. Kenyans are traveling on average 5 kilometers to access a healthcare facility. If you look at the map of Kenya there, you'll see concentration of healthcare facilities and doctors in urban areas. So that ratio, when you go to the marginalized communities, like for example, Nandi County, it's 1 to 100,000, 1 doctor to 100,000 guys. So really that 1 to 4,000 is an average. But the last thing, which is quite scary, is health insurance penetration is less than 3%. So there's a big issue around affordability. Households spend typically 24% of their income on healthcare compared to a WHO recommendation of 10%. What this means, 1 in 10 families in Kenya fall into poverty every year because of healthcare. So are we going to build hospitals? Are we going to hire enough doctors to address this problem? No. So technology is the answer. What we've done at HealthTech is we've come up with a very unique model. Our focus is on the uninsured and underinsured, so 97% of the market in theory. We run a 24/7 facility where we employ doctors. I'll take you through the model. But really the most important thing here is focusing on the uninsured, underinsured through hybrid use of technology. I'll show you how. This is a customer journey. We don't deal with emergencies, which is typically 5%. They go straight to hospital. Then some go through route A. Route A is toll-free number. We have to realize when we design solutions for Africa, Kenya, for example, has more phones than people, 65 million phones, population of 53 million people. 50% of those phones are feature phones. So if you have a purely smartphone application-based solution, you're missing out. Internet penetration is low, and guys cannot afford internet anyway. So route A, 80% of our customers go through that, toll-free. Very important statistic. Route B is virtual clinic and mobile app. I'll take you through virtual clinic, which is quite interesting. Basically, even without a phone, you can walk into this room like an ATM booth, speak to a doctor. So all these patients, whether you go through route A, route B, you connect to our digital operations center. So think of a call center, which we've employed doctors sitting there 24/7 on shift. We have GPs, nutritionists, and psychologists. So that means we're able to provide continuity of care. We have an EMR. You can book appointments. For example, for psychology, you can book the same psychologist consistently. We do manage 70 to 80% of the guys who come to us internally. So our doctors are trained. 20 to 30% we refer. You cannot deal with 100% of the issues through technology. Then we have lab and pharmacy partners to ensure we complete the cycle. We started in 2021, where we're only hitting 5 counties in Kenya. Right now we're doing 40 out of the 47 counties in Kenya through the technology. So really big coverage, and we're aiming to make the map orange before we close 2024. This is a very interesting example of what we're doing to integrate into the devolved healthcare system of Kenya. Kenya has 47 counties and each manages their own healthcare. What we've done here is we've deployed a virtual clinic in many dispensaries in rural communities. That's on the top right there is what you see a doctor doing a consultation with the patient. So these are facilities where there's the brick and mortar facility, there is a nurse, but there's no doctor. So patients walk in, they go through triage because there's a nurse, then they speak to a doctor virtually. They're able to get their medication on site, lab services on site. And these are rural communities. One of the unique things we've been able to do is to get doctors who speak local language. And this is demand driven. We'll also go ahead to hire doctors who speak sign language to get guys who, for example, have disabilities. So it's quite unique because think of Africa. Many guys are not educated. They cannot be able to speak in English or in our case Swahili. So you have to adopt to that. Below here is the stats. I don't want to bore you with that, but quick summary, we've done over 3,000 NCD patients in the last few weeks in this county. Our revenue model is subscription based, and I'll be able to explain through this slide. One of the biggest questions is how do you deploy this technology in rural communities without energy, without power, internet? Solar virtual clinics, which have a nurse, inverters. We have pharmacy fast programs where you can walk into a pharmacy and get virtual clinic. We've put virtual clinics in hotels where we are paid per bed per year. We have school virtual clinics where we are paid within the school fees per student per year. So really designed our solution to adopt the African market. Again, virtual clinics in action, same thing. So just to end my presentation, I wanted you to understand the model. What are we raising? We've raised $1.5 million recently, pre-Series A. We are in the process of raising 2.5, Q1 2025, for going into country 2. Our target is 7 countries within the East African region, and that's the plan for that is within Q1 of 2025. Happy to go through unit economics, etc., when we have more time.
Thank you. I like that picture of a kiosk, which shows the nexus between climate and health. You have about 2 minutes Q&A.
Thank you very much for the presentation. I've seen the model evolve, so congratulations on HealthTech. What will be interesting also for me is what is the impact of the UHC, and notably SHIF, for you in Kenya?
Very positive impact for us. We're actually one of the few excited people because in the old system, NHIF, telehealth, digital health was not claimable. With SHIF, the new system, the Digital Health Act allows us to make e-claims in the new process. The interesting thing is there are only 2 licensed telehealth providers who can do this, us and someone else. So that's a huge opportunity for us. So you think of rural communities, anyone can call anyone from Kenya and we can put an e-claim.
So just trying to understand your financials running ahead. You're running staff and doctors 24/7 to manage about 3,000 encounters a week?
No. So we are doing about 4,000 to 6,000 encounters a month. Yeah.
And so in terms of your subscriptions and how are you looking at, where are you in terms of margins and what are you looking at the end of the year?
So not yet broken even. We're at about 40% of break even. Our burn is quite high because of employing doctors. However, at scale, that doesn't change because a doctor typically sees a patient for 15 minutes, so 4 patients an hour. So when you scale, you're able to then flatten your OPEX and your revenues will go up. Happy to go through that, but when you look at the unit...
What's your number, like what is your patient level that you're going to break even? Where are you aiming for that?
20,000 active. We're currently at about 15,000 active.
And you said there are only 2 such providers in...
To his question, who can claim on the national health insurance, which is called SHIF? Yeah.
What is the team that runs this?
Yeah, I have a slide on that, but just to be quick, I lead the team. I'm the CEO. Finance background, I was the chief finance officer of the largest bank in the region. You might know Equity Bank. I was the CFO for Kenya. We have a strong team of the clinical side. We have a medical director, and we also have a lead psychologist focusing on the clinical team. On top of that, there's a chief operations officer, currently a guy called Steve Smith, many years, over 20 years, retired Royal Air Force. We also have strong HR, CIO, that kind of team. Yeah.
All right. So we've come to the end of the pitch session. The good news is that we have a networking session. As you can see, there's a big spread of refreshments and drinks both to my right and left. So that's all for you as you network and learn more about these startups and ask the questions and get the contacts. We've compiled some feedback from the judges, which we'll type together and share with each of the startups, including the ones that have showed interest in your startup. We'll be able to facilitate the introductions. I would like, in a special way, to appreciate the team that has been running the HealthTech Accelerator program, led by Olivia. Where is Olivia? Olivia, right there. Let's clap for them. There's also Emmanuel to my left. Emmanuel, maybe you can stand and wave. There's Karine to my right. We also have Joanne from Jepaigo and other Jepaigo colleagues. Maybe you can all wave. And we wouldn't be able to do it without our funders, led by Novartis Foundation. Sarah, you can wave. As well as Global Fund and Patrick J. McGovern Foundation. Looking forward to seeing you again 1 year from now with another cohort, and happy to help facilitate investments in these startups. They are all doing, as you've seen, very amazing work around the continent. And I can assure you that they are all investable. We've invested, as Vilgro, we've invested in about 4 of them independently, independent of all after they've been gone through the HealthTech Accelerator program. So we believe in them, and if we had more money, I think we would invest in all of them. Yeah. So enjoy the networking, enjoy the drinks, and let's mingle and interact out there. Yes, and thank you to the esteemed panel of investors. I'm looking forward to see how many will cut a small check to the startups. Yeah. I don't know whether Victor, is there any photo session with the startups and? All right. So all the startups can come on stage for a photo session. The rest of you, you can enjoy the drinks. Let's interact and mingle and have a good time together. Thank you.